When our main character, Sam, opened his eyes, he suddenly saw a strange light, as if he was in a completely different place. The young man woke up in complete confusion. He stood in the middle of the hospital corridor and did not understand what was happening. Suddenly, one of the doctors shouted for the oxygen supply to be increased to maximum. He then ordered the interns to continue performing chest compressions on the patient. After this, one of the interns began to perform chest compressions with great force. Several doctors and nurses tried to resuscitate the patient, but it seemed to be unsuccessful. Meanwhile, Sam just watched this whole scene from the side. Soon the guy noticed something strange about that intern. It seemed to him that what was happening was painfully familiar. It was then that it dawned on him, and Sam was completely shocked. The intern who performed the chest compressions turned out to be none other than Sam himself during his internship. Seeing that this was not producing results, the doctor ordered the defibrillator to be charged to 200 joules. Immediately after this, electrodes were pressed to the patient's chest in an attempt to bring him back to life with a discharge. However, the heart rhythm never recovered, and soon the heart stopped completely. Meanwhile, Sam was still in shock, reliving the memory. The tense atmosphere gradually filled the entire ward, and then the head doctor made a difficult decision. He ordered everyone to stop resuscitation efforts. Then the doctor looked at his watch. He officially announced the time of death for patient Cody. The medical record recorded that the patient died at 3:22 a.m. Sam just watched helplessly as it happened, powerless to change anything. Immediately after this, the doctor covered the deceased's face with a white sheet. Suddenly, something strange began to happen to the hero. Space and time seemed distorted. The protagonist felt as if an unknown force was pulling him back from this space. Sam suddenly woke up in a crowded subway car. Meanwhile, the train continued moving calmly along the city rails. Confused, Sam thought that everything that had happened was just a nightmare he had dreamed during a short sleep. However, the guy quickly pulled himself together and told himself that now he needed to concentrate because a hard day lay ahead of him. After that, Sam put his hand into the inside pocket of his jacket. From there, he took out his service ID. It had his name, Sam, and his job title as a doctor at Yongguk University Hospital written on it. The boy remembered that even as a child he had been unusually good with knives. Sam's memory flashed back to the day his parents returned home with their groceries and called their son over. The mother found the boy in the kitchen and asked what he was doing at that moment. Sam turned around with a smile, holding a knife and covered in red liquid. The parents panicked, and the mother immediately snatched the knife from his hands. However, when they looked at the kitchen countertop, they were completely stunned. It turned out that the boy, with amazing skill, perfectly cut up the sea bass and cut it into sashimi. Upon seeing this, his father declared that Sam was a true prodigy and decided that he would be the one to inherit the family sashimi restaurant. So Sam grew up with the confidence that he would one day take over the Shin family restaurant. However, one chance meeting completely changed his destiny. An interview with Korea's greatest surgical genius, Professor Peter, was shown on TV. At the end of the program, the presenter asked the professor a question and asked him to give advice to medical students who dreamed of becoming outstanding surgeons. At this point, Professor Peter thought for a moment. Then he replied that he did not yet consider himself such a great surgeon that he could give advice to others. Meanwhile, Sam listened attentively as the presenter noted that many called the doctor a man with the hands of a god. Despite this admission, the professor insisted that he himself still had a long way to go. He then explained that there was an old European proverb that was about 200 years old and that could help future surgeons. According to Peter, to become an outstanding surgeon, a person needed 3 qualities. Firstly, one had to have the eyes of an eagle. Secondly, have the hand of a lady. And finally, thirdly, have the heart of a lion. The professor explained that the doctor needed observation as keen as an eagle's eyesight. Moreover, his hands had to be as neat and careful as a lady's hand. At the same time, the surgeon had to have the fearlessness, determination, and firmness of a lion. These words sank deep into Sam's soul and completely captivated him. To the boy, Peter was the coolest person in the world. It was that interview that became a ray of light for Sam. The young man felt lost for a long time after his mother's death. Then the boy remembered the words that a person who once saw a bright light in the darkness would go towards it for the rest of his life. And for Sam, that light was the desire to become a doctor. So, filled with determination, Sam loudly declared to his father that he would definitely become a doctor. However, to his great surprise, his father immediately rejected this dream, which completely shocked his son. Sam then asked why his father was against it, since a parent would usually be happy that his child wanted to choose such a profession. In response, the father asked what kind of family they were, which completely baffled Sam. He explained that they were a family of merchants who had been in business since the Joseon dynasty, and their restaurant had been operating successfully in the market for 30 years. With great pride, the father added that their establishment had been featured on television 12 times. Moreover, the restaurant has collected thousands of reviews from visitors and has an excellent rating of 4.89. The man said all this only to emphasize how famous the Shin family's sashimi restaurant was. With all this in mind, his father declared that Sam's destiny was not to become a doctor at all, but to become a master of the sashimi knife. Sam had a natural talent with knives, so he had to use this gift to continue the family business. Sam countered that while he enjoyed cutting up fish, his real dream was to become a doctor who could save people. Despite these words, the father still refused his son, completely depriving the boy of hope. Frustrated, Sam lost his temper and asked why he couldn't follow his dream if he had studied so hard for it. The father then explained that this was precisely the main problem, because his son simply lacked the ability to study. After this, the man admitted with utmost honesty that Sam took after him and was just as slow-witted. The father then apologized sincerely, but still stated that there had never been anyone with outstanding academic abilities in their family. Trying to lift his son's spirits a little, the father showed him a rare grouper and offered to cut the fish. However, the hero refused to accept such a fate. He stated firmly that even if he failed, he would still try again and again, no matter how many times it took. After these words, Sam perfectly cut up the fish in just a few seconds. Having finished work, the guy ran out of the house, loudly declaring that he would definitely become a doctor. Unfortunately, his grades were too low to enter medical school. However, Sam did not give up and promised himself that he would definitely go there, no matter what it cost him. At one such moment, his sister entered the room and asked him to mend her torn skirt. At first Sam refused, but soon gave in, and with amazing skill carefully sewed up his sister's skirt. After Sam helped his sister, he escorted her out of the room, saying that he needed to study for his exams. When the day of the results announcement arrived, Sam checked the list of those admitted with excitement. Unfortunately, his name was not there. However, the refusal did not break the guy at all, and he immediately began preparing for a second attempt. But the result was the same again. Sam was rejected again. Despite this, Sam was not going to give up, so he devoted himself even more tenaciously to preparing for the third attempt. Finally, after many months of hard work, the day has come for the results to be published. This time the whole family's joy knew no bounds, and they even hung a festive banner in front of the family restaurant. Sam fulfilled his dream and became a medical student. At that moment, he sincerely believed that nothing could go wrong now. However, he had no idea what lay ahead. Soon the university was closed due to large-scale protests. Upon learning of this, the guy literally fell to his knees, completely crushed by what had happened. Sam's expression showed all the despair of a man who saw his dream crumble before his eyes. Having suffered defeat, he simply decided to return home and start cutting up fish. Sometime later, Sam was sitting at a bus stop and thinking about his future. It was then that his gaze fell on the huge hospital building. Despite the university's closure, Sam still managed to pass the exam and was accepted as an intern at Yongguk University Hospital. And this was far from an ordinary hospital, but one of the 5 largest and most prestigious in all of Korea. Every day, about 8,000 outpatients passed through it, and more than 2,000 people were treated in hospitals. Therefore, the medical staff here was incredibly numerous, thousands of doctors, nurses, and technical specialists. However, for Sam, the most important thing was something completely different. It was here that his greatest idol, Professor Peter, worked. Sam took a deep breath and prepared himself mentally. His path to becoming a doctor, which he had dreamed of all his life, was just beginning. Then, with confident steps, the guy entered the hospital, ready for his first day of work. Sam had barely arrived when one of the nurses called him. She reported that a patient in room 1705 complained of chest pain and urgently needed an electrocardiogram. Sam understood perfectly well that in cardiology, a quick ECG was of utmost importance, and he immediately began preparing the patient for the examination. The results of the study came back quite quickly and showed the patient's heart rhythm. After carefully examining the film, Sam noticed that the readings were slightly different from the previous day's results. After this, the guy took the ECG to the nurse and suggested reporting any changes to the attending physician. The picture looked like atrial fibrillation. Although it did not look dangerous, the patient still needed to be shown to a senior doctor. The nurse was pleasantly surprised by how attentive the intern was and remarked that he would definitely be loved there. Sam chuckled awkwardly and admitted that he had really hoped so. At that moment, a doctor suddenly appeared nearby and asked what the two were talking about instead of doing their work. The man turned out to be Charlie, a third-year resident known to everyone as Snake. Sam became noticeably nervous, quickly bowed, and greeted the doctor respectfully. Meanwhile, one of the staff members quietly whispered to Charlie that the new intern graduated from Yilong University. He explained that this was the same third-rate medical school that was closed due to a corruption scandal. After these words, Charlie looked at Sam with obvious disdain. This made the guy feel extremely awkward. The doctor then got straight to the point and asked if Sam had seen a patient with chest pain. The guy answered in the affirmative and immediately handed him the ECG results. After this, Charlie asked to see the patient's medical record for the previous night, and Sam handed it to the doctor. He explained that the patient's heart rhythm had been normal overnight, but that atrial fibrillation had developed in the morning. He also added that the condition did not yet appear critical, but still recommended further testing. Charlie stared at Sam with a hard look, and the intern felt like a frog in front of a snake about to strike. Then Charlie asked what the name of that guy from Yilong University was. Sam, without hesitation, replied that his name was Sam. After this, Charlie suddenly slapped the tablet onto his palm. However, instead of the expected reprimand, the doctor unexpectedly praised the intern's work, which completely stunned. Charlie added that it was always nice when an intern organized the paperwork so well. Hearing this, Sam breathed a sigh of relief and thought that it was worthwhile preparing the medical notes for the previous day in advance. The guy understood perfectly well that it was extremely important for him to make a good impression. Although the final grades for interns were given by professors, it was the residents who were the first to evaluate their work. However, Charlie then noted that a person from a closed university would have to work much harder than others. After this, the doctor returned the documents to Sam, advised him to work hard and learn a lot, and then left. These words hurt Sam because, in essence, the doctor said that he had almost no chance of staying to work at this hospital. Charlie explained that no matter how hard one worked, it was extremely difficult to survive in such a competitive environment. In response, Sam calmly said that he had been prepared for such difficulties in advance. However, the resident only briefly replied that it was only for his benefit. He then said that he would have a chance to stay at the hospital if he were recognized as the best intern of the year. This question left the hero speechless for a moment. The title of Intern of the Year was considered a great honor and was awarded annually to the most outstanding intern at Yongguk Hospital. For Sam, receiving this title would mean that his chances of becoming a doctor at this hospital would be almost 100%. However, another doctor immediately intervened in the conversation and asked Charlie why he had given the boy false hope. Ignoring this comment, Charlie replied that such a possibility still existed and advised Sam to work hard. Sam sincerely thanked the doctor for his advice and bowed respectfully, after which both doctors left. Left alone, the hero was outraged by the elitism that reigned in the hospital, but promised himself that he would definitely survive in this place. Sam dreamed of one day being photographed next to his idol, Professor Peter. Moreover, the boy dreamed that one day he himself would be recognized as an outstanding doctor, just like Professor Peter. Sam's thoughts were suddenly interrupted by a cheerful female voice that greeted him in a friendly manner. It turned out to be one of his fellow interns who invited the guy to go to lunch with him. Then a colleague complained that she had to collect signatures on 5 consent forms for surgical interventions at once. Seeing how the girl looked, Sam extended his hand and offered to help her collect some signatures. Sam told her to finish her work calmly and come back as soon as possible. The girl thanked him, saying that he had saved her, and handed Sam the documents. She promised to treat him to coffee later as a token of her gratitude. Sam only smiled slightly, watching the girl go. The guy then took the papers and started checking which patients needed to sign the forms. Looking through the list of names, he suddenly stopped at one name, Cody. Sam froze instantly because the name seemed painfully familiar to him. Almost immediately, he remembered the dream he had seen in the subway. The doctor then pronounced patient Cody dead, and the official time of death was exactly 3:22 a.m. Sam tried to convince himself that it was all just a strange coincidence. After that, he went to the patient's room. Once he reached the door, the guy took a deep breath and only then went inside. Sam introduced himself and then asked the patient to carefully read the consent form for the operation and sign it. Entering the room, he saw an elderly man lying on the bed with a woman next to him. However, as soon as Sam looked at the patient's face, he experienced a real shock. The patients had gray hair, deep-set, drooping eyes, and dark skin. In front of him were exactly the same facial features that he had seen in his dream. It was definitely the same patient. After that, Sam turned his gaze to the sign near the door of the room and finally confirmed that the patient's name was Cody. The woman sitting next to the man asked why Sam had come. A little confused, the guy stumbled over a few words. However, he then quickly pulled himself together and explained that he had come to tell about the procedure the patient was about to undergo. After this, Sam began to explain in detail all the details of the operation to the patient himself and his companion. At the same time, deep down, the guy continued to convince himself that everything that was happening was just an incredible coincidence. Suddenly, his thoughts were interrupted by the voice of a woman who addressed him. With concern on her face, she asked if everything would be okay with her father. While she was reading the documents, she noticed that the form indicated the risk of not surviving the procedure. Sam hastened to reassure the woman, explaining that the documents always listed all possible complications, even the rarest ones. Sam added that this procedure was performed more than 10 times a day, and all patients who underwent it were safely discharged. After this, the guy smiled and stated that the probability of a fatal outcome was practically zero. After all, it was Yongguk University Hospital, home to some of the best doctors in Korea, so everything should have gone well. Sam's words visibly calmed the woman, and her face immediately became more relaxed. She then turned to her father and told him not to be afraid. The man silently nodded in agreement. Sam said goodbye to them with a smile and left the room, feeling much more confident. Meanwhile, several hours passed, and night fell on the hospital. At 8 o'clock in the evening, Sam finally finished his shift, feeling completely exhausted. However, his working day was not over yet, as he still had a night shift ahead of him. So Sam hurried to the intern dorm, hoping to get some rest before it started. When he reached the room, he saw one of his neighbors, who was sweating all over from lifting weights. The strong guy was training hard, and the sound of metal weights echoed throughout the room. He lifted a huge barbell without much difficulty. Sam recognized his neighbor George and asked if he had been training again. The guy replied with a smile that he couldn't skip training, otherwise he would quickly lose muscle mass. George then noticed that Sam looked terrible. Hearing this, Sam collapsed on the bed and admitted that the day had been incredibly hard. After this, George asked if Sam had heard the story that was now being discussed throughout the hospital. The guy said that every March, when new interns arrived at the hospital, some kind of incident was sure to happen. Sam, lying on the bed, asked his neighbor not to bring trouble because he himself was really hoping for a peaceful shift. George agreed with him, and both sincerely wished that this night would pass quietly and without incident. However, lying on the bed, Sam could not stop thinking about the dream in which patient Cody died. At some point, the guy opened his eyes, trying to get these ridiculous thoughts out of his head, but anxiety did not leave him. Then Sam got out of bed, deciding to do something after all. Noticing that his neighbor had begun to put on a medical gown, George was surprised and asked if Sam was really going to study. The hero replied that he needed to study something. Sam was reading a book on coronary heart disease, and his friend was surprised that someone continued to study diligently even during internship. Sam thought that most likely, events would not turn out the same way, but even for the one chance in a million, he had to be prepared for anything. The time gradually approached 2 o'clock in the morning. While George slept peacefully, Sam continued to study medical materials and read books until late at night. The hero studied diligently, while his neighbor slept peacefully on the top bunk. After a long time, Sam stretched tiredly and complained to himself that after so many hours studying was becoming very difficult. It was at that moment that an emergency announcement suddenly sounded throughout the hospital. The public address system reported a cardiorespiratory arrest on the 17th floor of the West Wing. Then, over the loudspeaker, they ordered all interns to report to the scene immediately. Hearing this, Sam shouted at George to run faster, after which both boys quickly ran down the hospital corridor. The discussion was about performing cardiopulmonary resuscitation, the most critical situation that could arise in a hospital. On the way, their colleague Julie ran up to them. The girl shouted for them to wait for her near the elevator and then joined them. Once inside the elevator, the hero noticed that just recently all the patients on the 17th floor were in a stable condition. As soon as the elevator doors opened, the entire group of interns rushed down the corridor towards the treatment room. They had barely reached the place when they were met by the furious cry of the doctor. Charlie harshly reprimanded the interns for being late in a situation where a patient's life was hanging by a thread. After this, the doctor ordered one of them to take the ambu bag, and the rest to prepare to perform indirect cardiac massage. Sam was well aware that chest compressions needed to be continued for at least 30 minutes. One of the interns immediately began performing chest compressions, while the other used an oxygen bag. And suddenly Sam realized something terrible. The patient lying on the gurney turned out to be Cody, the very man from his nightmare. Sam was scared and couldn't understand how this was possible, whether his dream was really starting to come true. At that very moment, the head physician ordered the defibrillator to be charged to 200 joules and ordered everyone to move away from the patient. The doctor then applied electrodes to Cody's chest and attempted to revive him with a powerful electrical shock. The shock was ineffective, so the head physician ordered the defibrillator to be recharged. After this, the patient was given another electric shock. To everyone's relief, this time the heart rhythm finally returned to normal. The monitor showed a stable heartbeat, and the emergency was officially declared over. After the stress they had experienced, the interns breathed a sigh of relief. However, Charlie had no intention of giving them a moment's rest and immediately attracted the attention of the entire group. He warned that the later doctors arrived at a patient's home, the less time they had to save his life. The doctor then decided to test the intern's knowledge and asked how often the ambu bag should be compressed after intubation. The young doctors hesitated, as none of them knew the exact answer. The doctor then sarcastically remarked that they could not answer even such a simple question. Sam realized that the situation had gone too far. The guy then replied that after the airway was securely secured, the ambu bag needed to be compressed once every 6 seconds. Charlie looked at Sam seriously, but said nothing. Sam couldn't help but tense up, waiting for the doctor's reaction, and he continued his examination, asking increasingly complex and highly specialized questions. He asked what the diastolic pressure should have been during chest compressions. Sam responded by explaining that the intra-arterial diastolic pressure should have been greater than 20 millimeters of mercury. The doctor then asked about the correct dosage of amiodarone for a defibrillating rhythm. Sam answered without hesitation that they administered 300 milligrams of the drug at first. He also added that this was followed by further doses of 150 milligrams. After a whole series of correct answers, Charlie fell silent for a moment. He then chuckled and praised Sam, noting that at least one person in the room actually had a clue. Sam thought that he was able to answer so quickly only because the events from his dream had been constantly playing in his head all day. After this, the doctor turned to the other interns and scolded them for not knowing basic things. The graduates of Yongguk University were hit especially hard, as they lost to a person who graduated from a now-closed university. The other interns were noticeably embarrassed after such a reprimand. Then the doctor angrily ordered everyone to get out of his sight. As the group walked down the hallway, Julie noticed that the situation had ended rather quickly, with Charlie letting them go earlier than usual. George complained about Charlie and admitted that he hated him so much that he never intended to choose therapy as his specialty. Sam was relieved that Cody was alive, but he had a strange feeling that he was forgetting something important. At that moment, memories of the dream came back to Sam's mind. The guy looked at his phone and saw that it was already 2:40 a.m. Then he remembered that in his dream, the patient's death was recorded at 3:22 a.m. The events of his nightmare had already been repeated almost exactly once. This meant that if the dream continued to come true, Cody should have died in about 40 minutes. Determined to prevent this, Sam told his colleagues to go without him. They asked where he was heading, and the guy replied that he continued to be concerned about the patient's condition. Julie decided to go with him and asked Sam what exactly seemed strange. After that, both interns ran back to Cody's room. When they entered, the patient was sleeping peacefully under a ventilator. Sam then asked Julie if she had noticed anything unusual about his condition, and the girl thought for a moment. A few seconds later, Julie remembered that she had passed a patient in the hallway earlier that day. At that moment, she smelled cigarettes on him. This information immediately surprised Sam. Then the girl explained that at first she thought the smell was coming from the patient. However, she soon became distracted by other matters and no longer attached any importance to it. Sam thought about it. He realized that smoking itself did not cause immediate complications. However, if the patient was unable to give up cigarettes even before heart surgery, this indicated an extremely severe nicotine addiction. Armed with this new lead, Sam quickly walked over to the computer to open the patient's medical record. According to the patient's medical records, he smoked 80 packs of cigarettes a year, an incredibly high figure that shocked Sam. Moreover, the medical record showed that the patient also suffered from hypertension, diabetes mellitus, and dyslipidemia. Simply put, he had virtually every possible risk factor associated with vascular disease. In addition, his heart's ejection fraction was 35%, meaning that his heart's pumping function was severely impaired. Sam explained that the patient had undergone a procedure to restore the patency of the coronary arteries. However, since the stent was a foreign body, various complications could sometimes arise after the operation. Reflecting on all this information, Sam could not understand how the patient had died in his sleep if his condition had been stabilized. In desperation, Sam tried at all costs to remember at least some important detail from his dream that he might have missed. The guy even grabbed his hair with his hands from the intense tension, and suddenly a memory unexpectedly flashed in his memory. Sam remembered the term he had heard in his dream, refractory ventricular fibrillation, an extremely dangerous malignant arrhythmia. Realizing this, Sam panicked, because if such a condition developed, the probability of the patient's death was extremely high. Realizing the urgency of the situation, Sam drew Julie's attention to the heart rate monitor and pointed out the strange changes in the graph. The guy then explained that his heart rate was gradually starting to change, and unusual interference was already appearing among the waves. Julie began to realize that something really was wrong with the monitor. Without wasting a second, the boy ran out of the room to warn the senior doctors about the impending danger. Julie remained behind, completely shocked by the gravity of what was happening. Sam finally found his senior doctor and immediately reported the patient's worsening condition, but this news only angered Charlie. The resident asked if the intern had decided to lecture him just because he had recently received a little praise. Charlie had no idea how he was supposed to feel about a newbie trying to give advice to an experienced resident. Sam literally froze in fear, completely unable to understand how he should react to the doctor's rage. Meanwhile, the senior doctor looked at Sam with a look full of contempt and anger. Then Charlie stood up from his seat and aggressively poked the intern right in the chest with his finger. The doctor shouted and asked who had given Sam permission to assess the patient's condition on his own. Sam immediately regretted opening his mouth at all. He should have kept quiet because he wasn't a superhero who could see the future. However, to Sam's great surprise, the doctor suddenly asked how exactly he assessed the current situation. This took the guy by surprise. Charlie then invited Sam to express his opinion, since he was so persistent in trying to do so. Moreover, the resident noted with obvious mockery that making a diagnosis and choosing a treatment were, in fact, basic skills for any doctor. After that, he pressed the intern even harder, asking if Sam was now afraid to take responsibility. Sam realized that there was no turning back, so he decided to go all the way. The guy then loudly declared that, in his opinion, the patient might need to be connected to an ECMO machine. This proposal took the resident completely by surprise, and he immediately asked what exactly Sam meant. ECMO was a life support machine that temporarily replaced the heart's function and was considered a last resort. Charlie was puzzled and couldn't understand what was going on in the intern's head if he was proposing such a radical solution. The doctor then sarcastically asked if the guy had ever even seen an ECMO machine at his third-rate university. He shouted that the ECMO machine was not some kind of miracle cure and was used only as a last resort. However, the hero explained that, given the patient's extremely serious condition, the likelihood of developing serious complications was real. In response, Charlie only smiled mockingly, clearly finding what was happening quite funny. He asked if Sam really thought the patient, who had been stabilized, would experience the most dangerous arrhythmia. Sam confirmed his opinion, but deep down the guy himself could not believe that he actually dared to say such a thing. Sam knew perfectly well that the argument would not bring him any good. He was sure that his grade was completely ruined. But suddenly Charlie gave in and admitted that the intern's assumption was not completely impossible. These words visibly puzzled Sam. Having assessed the situation, the doctor picked up the telephone receiver. He called another doctor to check if he was currently on duty. Meanwhile, Sam and Julie looked at each other in bewilderment, completely unable to understand why the resident had changed his attitude so much. After some time, patient Cody was transferred to the intensive care unit. There he was placed under constant observation and placed in the intensive care unit. Charlie said he had already contacted the thoracic surgery department and ordered the patient transferred to intensive care. He then asked Sam if he was happy now, and the hero himself smiled and thanked the senior doctor for his decision. After this, Charlie remarked that he had never met such an unusual newcomer as Sam, and added that he would definitely remember his name. Then the doctor slowly said Sam's name again, with a serious expression on his face. After these words, the doctor turned around and left the room, leaving the two interns alone. As soon as Charlie left, Julie let out a huge sigh of relief, glad that all the tension was finally behind her. The girl then began to congratulate Sam, saying that he was incredible for being able to so openly contradict the snake doctor himself. Sam sheepishly admitted that he himself did not understand where such courage came from. As they walked down the hallway, Julie admitted that she thought Sam's actions were really cool, and these words pleasantly surprised the guy. After this, the girl continued to praise him with a smile and said that at that moment he looked like a real doctor. Sam just laughed awkwardly and shyly thanked Julie for the compliment. Meanwhile, in the intensive care unit, the monitor showed that Cody's condition remained stable. Sam and Julie sat down next to the patient's bed to continue to observe him closely. A few more hours passed and the clock showed 3:02 a.m. Sam began to get nervous because according to his dream, cardiac arrest was supposed to occur soon, but so far there was nothing suspicious. Meanwhile, Julie began to nod off in her chair. And then she suddenly fell right on top of Sam. The girl immediately began to hotly deny that she had even fallen asleep, while Sam could barely contain his painful grimace. Seeing how tired she was, the hero suggested that she go back, and Julie asked if they weren't going to observe the patient anymore. In response, Sam said that they had been monitoring his condition for quite some time now, and perhaps he was worrying so much for nothing. Feeling relieved, the guy was already getting ready to leave and took one last look at the peacefully sleeping Cody. But just as Sam turned away, the monitor suddenly beeped. The nurse panicked when she saw the heart rate chart and screamed that the patient was going into ventricular fibrillation. Almost immediately, an alarm sounded throughout the entire intensive care unit, signaling the start of cardiopulmonary resuscitation. The nurse called the doctor again, and Sam froze for a few seconds, realizing that his nightmare was beginning to become reality. However, the next moment the guy came to his senses and rushed to the patient to begin resuscitation measures. Sam shouted to Julie to grab the ambu bag while he prepared to perform CPR. Placing his hands on the patient's chest, Sam realized that everything he had seen in the dream had indeed been true. Completely overcome with horror, the boy frantically thought about how he would be able to cope with what was happening. A few seconds later, Charlie and another doctor rushed down the corridor towards the room. As soon as Charlie walked inside, he heard that the patient had indeed started going into ventricular fibrillation. Realizing the seriousness of the situation, the doctor ordered the interns to give him room so he could continue the chest compressions. After this, Charlie began performing chest compressions, while the hero just silently watched what was happening. It was at that moment that Sam felt a sudden realization. He remembered that everything had happened exactly the same as in his nightmare. Memories of the dream came flooding back to Sam, the same screams literally repeating themselves before his eyes. Then the boy finally realized that the scene he had seen in his dream was being played out right in front of him. Meanwhile, one of the doctors checked the monitor and reported that the heart rhythm had not been restored. He then asked to stop the compressions for a moment. Without wasting a second, Charlie ordered the defibrillator to be charged to 200 joules. Sam just watched in horror as it happened. If events continued to unfold exactly as his dream had predicted, then Cody should have died right before his eyes. Meanwhile, outside the intensive care unit doors, the patient's daughter cried inconsolably, calling for her father. The hero saw a vision before him. The patient was lying there with no signs of life, and the medical team could do nothing more. Sam felt helpless because, despite knowing in advance what was going to happen, he was unable to change the future. However, suddenly an authoritative voice ordered everyone to immediately step aside. At that moment, a thoracic surgery team rushed into the intensive care unit, rolling in an ECMO machine. Sam was filled with hope again, because the only people who could save the patient had finally arrived. The team was led by thoracic surgeon Sarah. Without wasting a second, the surgeon approached the patient and asked how long the resuscitation had been going on. Sam quickly replied that 6 cycles had already passed, that is, 12 minutes of continuous chest compressions. Upon hearing this, Sarah immediately ordered everyone to step back, as they were going to use both femoral arteries. Immediately after this, the patient was quickly covered with a green surgical drape. She covered Cody's lower body, leaving only the thigh area open to allow for the procedure. The medical team then began connecting the ECMO equipment. The surgeon instructed the assistant to start from the medial side and gain access to the vein first. The needle was carefully inserted into the patient's thigh area. When the syringe plunger was pulled back, it quickly filled with blood, and the vein was successfully found. Shortly after, Sarah asked for a guide, and the assistant immediately handed it over to her. A thin metal wire was then carefully passed through the needle directly into the blood vessel. One of the doctors, observing the ultrasound image, confirmed that the guide wire had already reached the inferior vena cava. After this, once the conductor was in place, the medical team continued the procedure. Sarah gave the command to find an artery, explaining that the blood should have been bright red due to oxygen saturation. For Sam and Julie, it was all astonishing. The whole process went so smoothly, as if a high-precision mechanism were at work. However, a problem arose. The assistant tried to puncture the artery, but no blood would flow into the syringe. The doctor was very surprised by the unexpected complication. Then he told the specialist that the blood flow had suddenly stopped. Faced with this problem, Sarah reacted instantly and ordered the chest compressions to be stopped immediately. She then told the assistant to pull the syringe plunger again, but this time to do it slowly and very carefully. Following her instructions, the doctor was successful, and soon the syringe was finally filled with bright red blood. The woman asked if he had managed to complete the task, and the assistant confirmed that everything had worked. Sarah ordered the guide to lead the way and warned him to stop at the slightest resistance so as not to harm the patient. After carefully inserting the guide wire, the assistant happily announced that the procedure had been successful. Once everything was ready, one of the medical team members turned on the ECMO machine. Soon the patient's blood began to circulate through the circuit of the device. The tubes activated, starting the extracorporeal life support system. Immediately after this, oxygen-rich, bright red blood began to flow back through the tubes into the patient's body. The machine thus took over the full functions of Cody's heart and lungs, which helped stabilize his condition. Sarah carefully examined the equipment and confirmed that blood flow was good and there were no recirculation issues. Thanks to this, the man's breathing finally returned to normal and his condition became significantly more stable. After the successful completion of the procedure, the surgeon praised the entire team, saying that they had done an excellent job. Meanwhile, Sam breathed a sigh of relief, completely exhausted after all the stress he had experienced. Suddenly, his gaze stopped on the wall clock, which showed exactly 3:22 a.m. The guy was shocked, because this was exactly the time of death he saw in his nightmare. However, unlike what happened in the dream, this time Cody's patient did not die. The man survived thanks to ECMO, which acted as his heart, and the next step was to find out the cause of the incident. Meanwhile, the head doctor hurried into the department and asked Charlie what had happened. The resident explained that the patient had gone into cardiac arrest, his heart rhythm would not return, and they had to use ECMO. Sarah then expanded on the explanation by stating that, fortunately, they had been contacted in advance at the request of Dr. Charlie. After this, Charlie looked at Sam and said that in fact, the proposal came from the intern. The head doctor was incredibly happy to hear the news and patted Charlie on the back, congratulating him on a job well done. Sam didn't even notice that the credit wasn't given to him, but just watched silently, as the manager said that they barely made it in time. After this, the hospital waiting room again sank into its usual calm. Sam held a few coins in his hand. The guy then went to the vending machine to buy himself a drink and relax a little. Sam wondered if what he had seen in the dream was really the future and how such a thing could even be possible. At that moment, Julie came up to him and asked if everything was okay with him. The girl said that she was only responsible for the oxygen bags, so she was much less tired than he was. Then she became curious about how Sam knew in advance that Cody's patient would go into cardiac arrest again. He himself was also puzzled over this, because the coincidence seemed impossible, given that too many details matched perfectly. Still unable to find a suitable answer, Sam awkwardly scratched the back of his head and said that it was just a premonition. It was clear from Julie's look that she didn't believe the story one bit. Suddenly, they both nearly jumped in fright when Charlie appeared completely silently right behind them. The doctor looked at them with his usual unfriendly gaze and ordered them to either buy something or clear the way. Immediately after these words, a can of coffee fell into the machine's compartment. Charlie took the drink he had just bought. However, before leaving, the doctor unexpectedly admitted that this time Sam was right, which greatly surprised the young intern. Charlie added that the decision to transfer the patient to the intensive care unit and call the ECMO team was correct. However, after just a second, he returned to his usual behavior and yelled at the intern not to get too cocky. Then the doctor handed Sam a can of coffee. He praised the guy with a grin. After this unexpected confession, Charlie turned around and calmly walked away, leaving the two newcomers behind. Sam and Julie remained standing there, speechless, holding the drink the resident had given them. Suddenly Julie screamed, which greatly frightened Sam. The girl stated that the hero had just received recognition, and then explained that Charlie had never given anything to anyone before. She added that receiving a can of the drink from him was practically tantamount to a declaration of love, which horrified Sam. Then the hero looked again at the can of coffee in his hand, still trying to comprehend what had happened. He still didn't understand what the dream was and how it had so accurately depicted what was about to happen. In the end, Sam decided not to think about it anymore and just accept the fact that he had managed to save a life. The guy felt satisfaction from helping the patient survive, and for now, that was enough for him. Soon, a new day dawned, the sun shining brightly on Yongguk University Hospital. Sam was looking forward to his day off and enjoying the long-awaited feeling of freedom with his roommate George. He said he was going to go to the gym, and Sam replied that he was going to go home and finally get some sleep. At that moment, Julie suddenly appeared and gave the hero a friendly slap on the back with such force that he almost fell to the ground. The girl joked that he had a broad back, which was perfect for such claps, and Sam complained about the sudden attack. Julie inquired about Cody's condition, and George reported that the operation had been successful, so the man would soon be discharged. Hearing this, Sam noticeably calmed down because that incident had been bothering him for a long time. Then Julie suddenly suggested to Sam that they go somewhere together, but the guy didn't immediately understand what exactly she was talking about. The girl then explained that she had received a message from another colleague inviting all the interns to get together and have a drink. Sam was surprised because he hadn't received any message, and Julie assumed that they had simply forgotten about him. She then invited George to come with her, but he refused, explaining that he needed to train. Then the hero tried to use the excuse that he was going home to sleep, but his colleague didn't even want to listen to him. Julie dragged him along, declaring that it would be a shame to sleep through such fine weather. They ended up going together to a restaurant called Yongguk Chicken, where the rest of the interns were already waiting for them. As they walked inside, Julie greeted everyone present. The other interns greeted the girl with great enthusiasm and began calling her the goddess of the medical faculty. Julie sat down next to Sam and invited him to join the common table. However, one of the interns looked at the hero with disdain and asked with displeasure why he had come with her at all. Then the irritated guy forcefully put his glass down on the table, openly showing his displeasure. Meanwhile, another intern was talking to the girl and complaining that this was the first time he had gone out to relax since the start of his internship. He was stuck preparing for surgeries and dressings over the weekend, and at 10 p.m. he simply passed out in the dorm. After this, he raised his glass and loudly announced that he was going to drink until he fell off his feet. Meanwhile, Sam watched from the sidelines, feeling out of place. He noticed that all the graduates of Yongguk University were very friendly with each other, and he couldn't help but envy their relationship. Suddenly, the same intern who had just complained turned to Sam and asked in a mocking tone what his name was. The hero gave his name, after which his interlocutor invited him to have a drink together. He then poured Sam a drink and asked him how he got used to working as a graduate of another university. Before Sam could answer, however, Julie intervened in the conversation and asked the others if they had already heard the rumors about him. With a mischievous smile, the girl began to tell everyone the story of how Sam managed to impress the formidable Charlie. Very quickly, these rumors spread throughout the establishment. All the interns were shocked by what they heard, and one of them even joked that the coffee Sam received was probably poisoned. After this story, the attitude of the other interns completely changed. Now they began to look at Sam as a professional. Thanks to this, the hero finally felt like part of the team, communicated with colleagues, and no longer felt like an outsider. Soon one of the guys asked what medical specialty each of them was going to choose. This conversation invariably arose at almost every meeting of interns, since the choice of specialty was considered one of the most important moments. One of the interns admitted that he was currently choosing between rehabilitation medicine and radiology. The conversation then turned to Julie, and one of her colleagues asked her if she still planned to become a pediatrician. However, Julie admitted that she began to have doubts because she had heard that the specialty was very difficult. Then one of those present suggested that she choose dermatology, and she replied that she was currently considering several options. In fact, the most popular specialties have always remained dermatology, ophthalmology, and plastic surgery. Therefore, the areas that brought in the most money or required the least amount of work became the most in demand. At that moment, Julie turned to Sam and asked what specialty he was considering. Sam replied that he was thinking about surgery, which immediately impressed everyone at the table. He then added that he also found the thoracic surgery team to be absolutely amazing, and his colleagues immediately perked up. Their violent reaction was understandable, since thoracic surgery was considered one of the most unpopular specialties. Most doctors tried to avoid it because of its danger and incredible complexity. Then one of the guys asked why Sam even wanted to choose such a difficult direction. In response, Sam just smiled awkwardly and admitted that he simply thought this specialty was really cool. At that moment, the guy imagined himself as a great surgeon. He dreamed of one day becoming a doctor, like Sarah. The other interns immediately joined in the joke and said that in our time, everyone could choose what they really wanted. After this, the whole company cheerfully raised their glasses to drink to the hero's bold choice. However, the same intern who had previously looked down on Sam took a sip of beer with a disdainful expression on his face. Already completely drunk, he stated that Sam had chosen surgery not of his own free will, but because he had no other choice. He said that a graduate of a closed university had no chance of getting into more prestigious and competitive specialties. One of the colleagues tried to intervene and told the drunk intern to shut up, but he didn't even listen. The guy said that none of them would have been able to get into the most popular destinations if they had not graduated from Yongguk University. Then he asked if he was the only one who thought so, after which the rest of his colleagues immediately began to scold him. Meanwhile, the drunk intern's face turned red, his cheeks were greatly swollen, and he was struggling to hold back a wave of nausea. However, he was unable to hold back, so the guy quickly ran out of the bar, and one of his colleagues immediately rushed after him to help. Sam watched what was happening in confusion and could not understand why this guy Jackie hated him so much. At that moment, one of his colleagues approached him and advised him not to take what had happened to heart. The guy was dead drunk. In response, Sam calmly said that everything was fine and thought about how it was impossible to meet only good people in a hospital. He reflected that after a lifetime of studying, some people did not have the best communication skills. After all, just because a person became a doctor did not mean that he was automatically a mature individual with a good character. As Sam took another sip of his drink, his eyes suddenly went wide. Space and time around him began to distort again, leaving the boy completely speechless. A moment later, Sam found himself alone in the dark space again and immediately realized that he was experiencing the same feeling as last time. Then a new vision appeared before him. There was chaos everywhere, and someone's voice was loudly demanding that he hold back some guy. The next second, Sam saw the intern start a fight right in the bar, with broken bottles scattered all over the floor. Then he saw himself in front of his eyes, covered in bruises, with a bloody head, while his colleagues rushed to his aid. Sam was completely stunned to see himself in such a state. His eyes widened in horror at such a terrible omen. The next moment, the guy returned to reality, hearing Julie's worried voice calling his name. The girl asked what had happened, as Sam had suddenly seemed to have passed out, but the intern only replied that nothing had happened. However, Sam was completely confused and tried to figure out if he had had one of those strange dreams again. He remembered the vision he had seen and was afraid that this time everything would happen exactly the same as last time. However, the hero tried to convince himself that all this was a coincidence and that he had no supernatural abilities. Under the pretext that he needed to go to the toilet, Sam got up from the table, hoping to clear his head a little. As he walked, the boy thought that he should have gone straight home to bed, and all these visions were probably the result of overwork. Sam decided that the mood had completely soured because of his drunk colleague, so he was going to say goodbye to everyone and leave. However, his gaze suddenly fell on the boxes of drinks, and the guy immediately realized that this was exactly what he had seen in his recent vision. It was at this moment that a drunken Jackie returned to the bar, whom the others were trying their best to restrain. In the midst of all this commotion, the guy lost his balance and crashed right into a stack of boxes. Just as Sam had seen a few minutes ago, glass bottles began to fall down. The next moment they crashed to the floor with a loud clang. After the fall, the rest of his colleagues rushed to help Jackie, who found himself right among the fragments. Julie approached Sam worriedly and asked if he was okay, and the guy replied that nothing had happened to him. However, he then saw that the drunk intern had actually cut himself on the shards of glass, just as had happened in his vision. Sam realized that everything had happened again, just as he had seen it before, and began to wonder if he had the ability to see the future. Back at Yongguk University Hospital, Sam tried to get his thoughts in order. He opened his notebook and wrote down everything he had already discovered about his strange premonitions. The first thing the guy noticed was that the visions always appeared completely suddenly, and time seemed to stop around him. Moreover, each omen showed events that were soon to happen very close to him. Moreover, the interval between the vision and the event was not the same, sometimes only a few minutes passed, and sometimes a day. So far, Sam had only had 2 such visions, so he couldn't draw any final conclusions. However, the boy was afraid that this would start happening more and more often, because hospitals were a place where accidents happened all the time. Realizing this, Sam began to think that every time he had a new vision, he would now have to make a difficult choice. The boy understood that he had to decide whether he would change the future or simply let events take their course. After this, Sam made another entry in his notebook. He wrote that he could now change the future. Thus ended a turbulent March that marked the beginning of a completely new stage in Sam's life. During his shift, an intern brought a tray of food to one of his patients, an elderly woman. The old woman sadly said that this day was his last in their department, which surprised Sam quite a bit. The guy reassured the woman, explaining that he hadn't gone anywhere far, but was simply being transferred to another department in the same hospital. The patient then praised the intern's hands, saying they were so soft that she felt no pain while the blood was being drawn. While Sam prepared her hand for the procedure, the hero promised that everything would be quick and completely painless. As always, with impressive accuracy, he hit the elderly woman's vein on the first try. After this, the old woman said with regret that she was sorry to see him go, because she was already planning to give him her granddaughter in marriage. Sam decided to join in the joke, and the woman confidently declared that her granddaughter was an exact copy of her grandmother. Intrigued, Sam asked how old the girl was, and the old woman replied that her granddaughter was 11 years old and already knew the multiplication table. With this answer, she put the young intern in an extremely awkward position, and the other patients burst into laughter. When Sam left the room, one of the nurses praised him, noting that he had become very good at drawing blood. She explained that an intern's talent for various medical procedures was usually noticeable during the very first rotation. She spoke about medical procedures without exception, from the simplest manipulations to the most complex surgical operations. According to her, it was the skill in performing minor procedures that became the foundation for carrying out major operations. A little embarrassed, Sam asked how she rated his skills and whether he was even average. In response, the nurse gave him a thumbs up and admitted that he had the best hands she had ever seen. Sam also got along well with patients and would definitely become a good doctor, regardless of his future specialty. These words touched Sam so much that he even jokingly pretended that he was about to cry. As they walked down the hallway together, the nurse asked which department he was going to for his next rotation. The intern was about to answer, but at that moment someone called out to him, calling him a scoundrel. Sam immediately turned around to see who was calling him. To his surprise, Charlie was standing in front of him. After this, the doctor led the intern to a relaxation area where there were several vending machines. He handed Sam a can of coffee and asked if today was really Sam's last day in the therapy department. Sam confirmed that his next rotation was scheduled to be in the emergency department. Hearing this, the doctor winced and warned that he would have a very difficult time there, since he would have to work with a certain axle. Charlie then asked if Sam still planned to become a surgeon, and he confirmed that he had not changed his plans. At this point, the hero panicked, wondering how this news had managed to spread so quickly throughout the hospital. Afterwards, Charlie stated that it was even for the best, because if Sam had chosen internal medicine, he would have simply destroyed him. Sam laughed nervously and jokingly remarked that after such words, the therapy department began to seem like a rather attractive place. However, Charlie immediately and rudely told him to get lost. He then gave him advice, wishing him to work hard in other departments and not to disgrace him, since he was his first mentor. After a short pause, the doctor, with a barely noticeable smile, finally admitted that the boy had performed well this month. Having received such praise, Sam literally beamed with happiness and broke into a wide smile. He thought about how he could never have imagined that he would be able to build such a relationship with someone like Charlie. After that, Sam headed to his next challenge, the emergency medical center. However, as soon as he found himself in front of the new department, the hero already felt completely exhausted, although the work had not even begun yet. A total of 8 interns were assigned to the department. They were to work 24-hour shifts, divided into 2 teams of 4. However, Sam soon realized that the real problem was not the schedule, but the composition of his team. The first to appear was Vincent, a Yongguk University graduate who was widely known as a terrible slacker. It then turned out that Jackie was also on their team, and what's more, his arm was in a cast, which only made the situation worse. Sam was depressed and couldn't understand why, of all the people in the hospital, he had been assigned such partners. Meanwhile, Vincent began to scold Jackie, indignant that he managed to break his arm at this very moment. In response, the guy explained that he had to wear a cast for a whole month, so he would not be able to do heavy work. Hearing this, Vincent irritably remarked that if Jackie couldn't work, then the others would have to do his duties for him. Sam panicked. This department was already considered one of the most difficult places, and now one of the team members was injured. Vincent then asked Sam what they should do now, and the hero replied that all they could do was work hard. The intern looked at him strangely and stated that he had completely relied on him, which left Sam stumped. Both of his colleagues immediately shifted all responsibility onto the hero and announced that he was becoming the team's main asset. Hearing this, the hero only sighed heavily, remembering that ever since his university days, he had had no luck with group projects. Suddenly, Sam froze in surprise, seeing right in front of him a huge hamster dressed in a medical gown. Completely confused, the boy rubbed his eyes several times, deciding that he was already hallucinating due to exhaustion. However, looking again, Sam realized that it was not a hamster at all. In front of him stood a girl with long bangs and a serious expression on her face. The rest of her colleagues greeted the girl happily and told Sam that her name was Chelsea and that she was also part of their team. After this, the girl bowed politely, formally introducing herself to everyone present. Vincent explained to Sam that Chelsea was considered a true aristocrat at Yongguk University, which completely confused the guy. He explained that her entire family, starting with her grandfather, worked as professors in the medical faculty of this university. That is why absolutely all the hospital professors knew the girl well and treated her in a special way. At this point, Vincent showed 2 large bags filled to the brim with drinks that he had bought for everyone in advance. Smiling smugly, the intern explained that he had bought the buns and drinks specifically to win over the professors. After this, Sam decided to be polite and offered one of Chelsea's drinks. The girl briefly looked away from the phone and looked at it silently for a few seconds. However, she then simply turned away and completely ignored the offer, leaving the hero without a word. Sam thought about the difference between them. Chelsea was considered the hospital's aristocrat, while he was just an intern. Sam sighed heavily and began to wonder how he would ever survive in such company. At that moment, the door of the room slowly opened. A man walked inside and introduced himself as Axel, a third-year emergency room resident. After this, the entire team of interns bowed respectfully and greeted him. The resident asked with displeasure when they would finally send him normal people, and then he finally introduced himself officially. After that, he told everyone to follow him. He was going to tell them how the emergency room worked. As the group walked down the hallway, Axel asked a question, wondering if they knew what the word apocalypse meant. Then Vincent replied that it was something like the end of the world, with fire falling from the sky and the gates of hell opening. With a satisfied smile, Axel stated that he knew very well what the apocalypse was. He then threw open the doors of the emergency room and declared that this very place was the real apocalypse. As soon as the interns saw the picture that opened up before them, they were immediately horrified by the chaos that reigned around them. There was absolute madness in the emergency room. Relatives were screaming, patients were being wheeled in one after another, and a man was lying exhausted on a gurney. Nearby, a desperate mother begged for help for her wounded son. All 4 newcomers literally froze in place, completely at a loss as to what to do in the midst of such chaos. With a grim smile, the resident greeted them and informed them that this was exactly what the emergency medicine apocalypse looked like. Despite the fact that it was still early morning, the department was already overcrowded with a wide variety of patients. Among them was a student who complained of severe abdominal pain. Nearby was a woman with severe constipation, and next to her sat an office worker who was suffering from dizziness and vomiting. There was also a boy who was bitten by a dog and a foreign worker who injured his fingers at a construction site. Sam realized that things were completely different here than in the therapy department, with each patient arriving with completely different symptoms. Looking at all this chaos, Axel asked if they understood why the emergency room even existed. Vincent answered hesitantly that it was intended for treating patients in critical condition. Axel then explained that the main task was to first provide assistance to the most seriously ill patients and then send them to the wards. This is why an emergency medicine physician must be knowledgeable in virtually all clinical areas. After this, the resident asked if everyone understood his explanation, and the entire group unanimously answered that they understood. The doctor then ordered everyone to get to work and immediately led the newcomers straight into the center of this chaos. The first thing the team did was approach the girl who was complaining of stomach pain, and the Axel asked if her stomach pain was severe. He then asked the patient to bend her knees and began to gently palpate her abdomen, trying to determine the source of the pain. The girl screamed in pain, but managed to explain that the discomfort was only felt in the upper abdomen. After conducting several examinations, the resident informed the interns that the X-ray, ultrasound, and blood tests revealed no abnormalities. Based on this, he concluded that it was most likely not appendicitis, but ordinary gastritis. The doctor advised the girl to return to the hospital if the pain moved to the lower right abdomen, as it could be appendicitis. Axel then explained to the newcomers that such simple cases would later become part of their own responsibilities. The resident then approached the woman with constipation and informed her that she would need an enema and then have an ENT examine her ear. While examining a boy who had been bitten by a dog, Axel reassured the child, explaining that the bite was not too deep. He then explained to the foreign worker that the wound on his fingers was deep and would require stitches from plastic surgeons. Sam was genuinely impressed with how quickly the resident handled cases across multiple disciplines. The third-year student in the emergency medicine department seemed to him like a real deity who managed to do everything at once. Axel then gave the interns one last instruction. He pointed to the monitor, which displayed a huge list of tasks, and Sam was literally shocked by the amount of work. The resident added that at this point a person could already be considered an average worker if he at least didn't create problems. After that, the doctor divided up the responsibilities and sent Sam and Chelsea to help in the orthopedic and thoracic surgery departments. So continued another busy day at Yongguk University Hospital. It was only after a long time that Sam finally managed to take a short break for lunch. However, the guy felt completely exhausted after spending the whole morning treating wounds and drawing blood. Sam realized with horror that he would have to maintain this pace for 24 hours straight. Sam soon noticed Chelsea sitting alone at one of the tables in the hospital cafeteria. The girl ate in a very unusual way, without taking her eyes off her phone and completely oblivious to what was happening around her. Then he sat down at the same table and noticed that, despite the morning bustle, she got here very quickly. Without even looking up from her phone, Chelsea replied curtly that it was. After this, there was an extremely awkward silence at the table, and Sam had absolutely no idea what to say now. The guy then tried to cheer himself up, deciding that it was just their first day at work and they would be able to find common ground. Meanwhile, Chelsea continued to eat calmly, showing no emotion at all or the slightest interest in the conversation. Sam quickly realized that the girl was the type of person who was very difficult to approach. However, in an attempt to lighten the mood a little, he offered Chelsea one of his shrimp tempura. However, the girl immediately refused, after which the distance between them began to feel even stronger. However, Sam was not about to give up. He asked what department she had been on her previous rotation, and also if she knew Charlie. However, Chelsea again responded shortly and rudely, and the hero was finally left speechless due to her complete lack of interest. In a final attempt to establish communication, Sam remarked that he had really enjoyed working in therapy. Suddenly, Chelsea slammed her phone down on the table, leaving Sam completely stunned. With undisguised fury on her face, the girl asked what exactly he found interesting about this. Chelsea described how terrifying it was to spend 24 hours straight in the emergency room without even seeing daylight. Then the girl stood up from her seat and screamed, wondering how anyone could find such work interesting. For any mistake, even the most insignificant, they were shouted at or even subjected to force. The girl finally lost her temper and admitted that she hated this job, and the patients themselves only disgusted her. In her opinion, this department was the most terrible place in the hospital, and then she remembered one incident that happened several years ago. She told a story about a drunk patient who suddenly attacked an intern, and he left his medical career due to an injury. The girl then asked if it wasn't scary, and Sam agreed that the situation was indeed quite scary. Having calmed down a little, the girl sat down and complained that she did not understand why people were so eager to become doctors. Then Sam became interested and asked why she decided to become a doctor herself, and her answer surprised him. Chelsea admitted that she chose this profession only because her parents told her to. Then Sam realized that she lived in a completely different world because he himself had to fight with all his might to become a doctor. He reflected on the fact that many people became doctors not by calling, but because of good grades or because of parental pressure. As a result, they spent their entire childhood and college years pursuing a dream that was never their own. The girl added that she had no talent for communicating with patients. She simply wanted to finish her internship so as not to see them anymore. Suddenly, a strange sound came from Chelsea's direction, and her hair completely covered her face. However, soon the girl sighed with great relief, as if a heavy burden had finally fallen from her shoulders. She then pointed to Sam's food and asked if she could try a piece. After this, the girl reminded him that he had previously offered her tempura. Sam noticed that she had refused the offer at the time, but the girl said that the dish looked very appetizing now. Faced with this change of mood, Sam chuckled slightly. Then he decided to play along and said that it was too late to change his mind, and the girl immediately called him greedy. However, Sam soon revealed that he was only joking, after which he handed her the bowl, and she happily thanked him. The hero realized that, despite her unusual character, the girl was very honest and straightforward. So the young man felt relieved, thinking that they would eventually get along during the internship. Meanwhile, some time passed, and night fell on Yongguk University Hospital. Axel was in his office typing something on his computer, filling out the intern's first week evaluation form. He started with the guy with the injured arm, Jackie, who he didn't think was even worth evaluating. He then moved on to Vincent, noting that he worked quickly and had good skills, but often shied away from work. Finally, it was his colleague Chelsea's turn, and the resident sighed heavily, as she was giving him quite a headache. The doctor believed that her work abilities were weak. Although the girl seemed smart, she constantly repeated the same mistakes. It didn't matter whether she was the daughter of a professor or a president, as long as the assessment had to remain fair. Sam was the last one left. The resident admitted that he still didn't understand this intern. He was showing results better than expected. Sam was a graduate of a closed university, but his skills turned out to be better than most of Yongguk's graduates. What stood out most was his dedication, but Sam didn't come across as an obvious genius or elite specialist. Ultimately, the resident concluded that the intern's assessment remained ambiguous. Shortly after, the second week of work began, and Sam asked Vincent if the 3 sets of blood cultures had been completed yet. However, Vincent avoided the task, claiming he needed to change his bandage. The patient turned out to be an elderly woman, and Sam immediately realized that finding a vein would be difficult. Sam accused Vincent of deliberately shifting this task onto him, but he only pretended not to understand anything. Suddenly, Jackie noticed that their colleague Chelsea had been missing for quite some time and wondered where she had gone. However, soon a furious scream echoed through the hospital corridor, causing all 3 to flinch. They then saw a man with a menacing appearance who was shouting and pointing an aggressive finger at Chelsea. Tears streamed down her face, and she seemed to be frozen with fear and only cowered, unable to react to the man's screams. The enraged man screamed that she had turned his father's hands into a pincushion. Furthermore, he did not understand how the doctor could fail for 20 minutes while the patient was literally burning with high fever. Jackie noticed that their colleague was in trouble and added that drawing blood should have become a simple task for her long ago. Drawing blood was one of the most common duties of interns, but it also remained one of the most difficult procedures. The man finally lost his patience and demanded that a nurse be called to take blood from his father. The nurse tried to explain that it was specifically an arterial blood test, so the procedure had to be performed by a doctor. However, the man became even more angry and declared that a person who was unable to even draw blood could not be considered a real doctor. Jackie wondered what the point of being a hospital aristocrat was if she couldn't even handle such a simple procedure. Seeing what was happening, Sam decided to intervene and quickly headed to the scene of the conflict. Coming closer, he announced that he would take blood instead of her, which completely surprised both the man and his colleague. The man then looked at him closely and asked if he really was a doctor, and Sam confirmed it with a smile. Soon after, he rolled up a wheelchair and began preparing for the procedure. Approaching the patient, he apologized and explained that in larger patients like his father, it was sometimes a little more difficult to find the vessels. Sam noticed that he was actually thinking about his own father, who was also quite a large man. Of course, this was an outright lie, since Sam's father was actually quite thin. The blood tests were not dependent on the patient's body type, and Sam himself was simply building a trusting relationship with the patient. Sam then turned to the patient and asked him to sit up, explaining that this test was indeed necessary. However, the man's son immediately became angry and threatened the intern, saying that he would destroy the entire hospital if his father suffered again. Sam assured him that there was nothing to worry about, but he knew he was still a rookie and far from perfect. The hero reflected on the fact that, unlike Chelsea, who spent her first rotation in the pathology department, he gained practical experience. To begin the procedure, Sam asked the patient's son to press firmly on his father's right wrist to stop the bleeding. The man complied with the request without further questions and pressed gauze onto his father's wrist, trying to stop the bleeding. After this, Sam adjusted the patient's position and asked him to remain still so that the procedure would proceed quickly. Looking at the man's hand, Sam immediately understood why his son was so angry. The wrist area was completely covered in bruises. Typically, the test was performed by puncturing the radial artery in the wrist area, which is located deeper than the veins. This is why the doctor first needed to feel the pulse of the artery with his fingers, in order to accurately determine the location of the needle insertion. However, the patient's arm was so badly bruised that it was impossible to feel a pulse in that area. Faced with this problem, Sam realized his only option was to look further up his arm for a suitable spot. It was at that moment that he remembered Sarah's incredible skill, whose fingers seemed to have built-in ultrasound. Then, during the ECMO procedure, she was able to find the collapsed blood vessel without any hesitation. Inspired, Sam became determined and told himself that he could not become a doctor who was unable to find the vessel. He began to gently feel the patient's arm and soon felt a very weak pulse just above the bruised area. Then he concentrated as hard as he could, trying to pinpoint its exact position, and even asked the artery to seem to show itself. And suddenly Sam clearly felt a pulse right under his fingers. The young man was very happy that he had finally found the perfect place for a piercing. After this, Sam warned the patient that it would hurt a little and asked him to bear with it just a little longer. The intern then very carefully inserted the needle, hoping that the artery would not move. Meanwhile, the patient's son watched Sam's every move, trying to figure out if the young doctor was performing the procedure correctly. However, the hero soon began to worry, as the blood was not flowing into the syringe as quickly as it should have. The tension around them was growing, the patient's son was becoming irritated again, and Chelsea watched with alarm. Everyone froze in anticipation, already losing hope that the main character would be able to complete the procedure. But suddenly, bright red blood began to quickly fill the syringe, and Sam breathed a sigh of relief, realizing that everything had worked. The blood draw was successful, and the syringe quickly filled with the required amount of blood for analysis. After completing the procedure, the intern transferred the sample into a special test tube for sending to the laboratory. Sam then announced that the procedure was already complete, completely astonishing the patient's son with his speed. He joked with a smile that they had gone through so much trouble just for a little bloodshed. The patient was genuinely impressed and admitted that with Sam, he only felt the first injection and didn't even notice the blood being drawn. The man was so impressed by the intern's skill that he even tried to give him a cash reward, but Sam refused. Then, defending his colleague, he said she was a great doctor, but everyone just had bad days sometimes. After these words, the situation eased, and the patient's son thanked Sam for a job well done. Suddenly, resident Axel ran to the scene to find out what had happened. He immediately asked about taking blood and said that he even brought an ultrasound machine since the intern could not find the vessel. However, Sam calmly replied that he had already completed the procedure, which surprised the resident. Axel then asked how exactly he had managed to find the vessel, and Sam explained that he had done it manually, by feeling for it with his fingers. This answer greatly surprised the doctor. Seeing the abilities of the newcomer, the resident was impressed and admitted that Sam was not bad at all. But the doctor still advised him to wait for the ultrasound machine next time, since he was just lucky to get it on the first try. After this, the resident turned his gaze to Chelsea, who had been standing with her head down the whole time, burning with shame. The girl's expression showed how upset she was that she was unable to complete the procedure. The resident sighed heavily and tiredly, since he himself did not know how best to act in the current situation. So he told Chelsea to go to the bathroom, cool off a bit, and calm down. The girl silently obeyed, bowed respectfully, and left that place. Chelsea then headed towards the emergency room exit. After this, Axel sighed wearily again and asked Sam to keep an eye on his colleague so that she did not get a reputation as a malignant. The term malignant was used among doctors as a derogatory term for a person with a bad reputation in the department. In other words, this was the name given to a colleague with whom no one wanted to work. Receiving such a stigma was considered the worst thing that could happen to a medical professional. Sometime later, the situation in the hospital completely calmed down. The boys went outside to freshen up, and then Julie asked Sam to take care of Chelsea. She admitted that it was hard for her to watch Chelsea's situation. She had been going through hard times since her student years, as her classmates silently excluded her from their social circle. Sam was surprised because he thought that, as a member of the elite, Chelsea would have been popular at university. However, Julie explained that this was the main cause of her problems. Because of her status, any mistake Chelsea made, even the most minor one, immediately became a reason for those around her to criticize her. Sam himself knew well that constant psychological pressure could make any person make mistakes. And for someone with Chelsea's character, such pressure only made him withdraw even more. Sam added that, of course, he could help Chelsea a little, but ultimately everyone had to do their own job. However, Julie admitted that she was very worried because she was afraid that Chelsea would one day make a serious mistake. Sam concluded that as long as the error did not endanger the patient's life, a month should pass without incident. He tried to calm the girl down, saying that it was unlikely that anything really serious could happen during a one-month internship. However, at the very moment he said those words, his eyes suddenly widened. Suddenly time stopped, but Sam was sitting on the same bench. The young man was completely shocked by what he saw, and immediately realized that the strange feeling had returned again. Suddenly, a voice came from somewhere behind me, demanding that all the emergency room interns be gathered. Sam saw a group of newbies lined up in front of the doctor in the middle of a completely dark space. The senior resident stated that this was the first time in his entire career that he had encountered such a situation. After these words, all the interns in the vision just lowered their heads. They looked completely depressed. The doctor then got straight to the point and announced that, in short, they would all get a C for the month. Sam was completely shocked because he couldn't believe that he would get a C grade after only 2 months of internship. At that moment, it finally dawned on him that such a low grade meant the end of his career at Yongguk University Hospital. Soon the senior resident yelled at the interns again, demanding to know what exactly they had done. The senior doctor looked at the group of newcomers with open contempt and disappointment. Sam despaired that everyone couldn't just get a C, because for him, that would mean the end of his career at this hospital. However, the resident stated that no one should even think about complaining. If one person made a mistake, then responsibility fell on everyone. After this, Sam wondered who exactly was to blame for such a serious incident. Axel tried to apologize, but the resident interrupted him and demanded that he stop covering for anyone. After this, the senior doctor grabbed his head at the thought of a lawsuit for medical malpractice committed by the intern. When Sam heard about the lawsuit, he was in real shock because he couldn't believe what he was hearing. Such a mistake would have turned the entire hospital upside down, and a simple apology would no longer have been able to solve the problem. After this, the senior resident turned again to the group of interns and demanded to know the culprit of the incident. Sam panicked and tried to figure out who was responsible for everything that had happened. But at the most tense moment, the vision suddenly ended, leaving Sam completely in the dark. Returning to reality, the boy screamed in fear and threw his food, which greatly frightened Julie, who was sitting next to him. The girl flinched at his unexpected reaction and asked why he suddenly behaved like that. Deeply embarrassed, Sam quickly apologized and assured her that nothing had happened, trying to hide the panic that had gripped him. After that, he grabbed his head, feeling very irritated that the precognition ended just as unexpectedly. Meanwhile, the break was over and the guys returned to their workplaces. From that moment on, Sam began to carefully observe everything that was happening around him. Returning to the break room, the young man kept a close eye on his 3 teammates. Sam began to secretly analyze his 3 colleagues, trying to figure out who would be the culprit of the incident. At that moment, Vincent stretched and noticed that at least on the weekends, the hospital had become much calmer. He then said that he was going to rest in the echocardiography room and asked to call him if anything happened. Sam took the opportunity to ask if he had performed the lumbar puncture and had obtained all 4 copies of the patient's consent. He came to the conclusion that despite his habit of looking for easy ways, Vincent was not the kind of person who made mistakes at work. Jackie followed him and tried to avoid work with his colleague, but he immediately sent him back. Sam thought that, although Jackie was a candidate for the role of troublemaker, the chances of him making a mistake were slim. After he eliminated the other 2 interns, there was only one most likely candidate left. His colleague Chelsea, who had been silently working at the computer, became the prime suspect. Sam watched her from a distance, with suspicion and concern. But suddenly the girl herself approached him and asked if they could talk a little, which caught Sam off guard. Chelsea reminded Sam of the question he had asked her earlier about why she had decided to become a doctor in the first place. She then admitted that since childhood, her parents constantly forced her to study. She ended up going to medical school without ever really thinking about what she really wanted to do with her life. And now, having become a doctor, she was afraid of patients, considered the work very difficult, and more than anything in the world, she was afraid of making a mistake in treatment. Chelsea added that she had made 5 mistakes today alone and felt like she had never become a doctor. Sam realized that before him stood a typical example of an excellent student who had suffered from excessive pressure from others all her life. After this, the young man finally convinced himself that Chelsea would be the culprit of the future lawsuit. Sam then began to think that if he didn't do anything, all the interns would get C's, which would be a real disaster for his career. So he looked at the girl seriously and told her not to try to cope with everything alone anymore. Chelsea was completely confused. Then the hero said that even if she made a mistake, the other interns would be able to help her. He also said that she should have definitely turned to him and Vincent for help. Sam suggested that they help each other and thus avoid mistakes, since they were all one team. He hoped that if he could get this thought into her head, he could prevent a fatal mistake. Then Chelsea suddenly said that Sam was a very kind person, which visibly surprised the young doctor. Blushing slightly, the girl admitted that none of her colleagues had ever said anything like that to her before. Sam looked a little embarrassed and replied that such things were perfectly natural between colleagues. Afterwards, the girl asked if he was so kind because his name sounded similar to the Korean word for kindness. Sam then explained that his name had no such meaning at all and that the character in his name actually meant fresh fish. He said that all members of his family had names associated with fish, and he was the only one who did not continue the family business. This unusual story made the girl laugh completely sincerely. Sam felt a little embarrassed again, but he realized that Chelsea wasn't as gloomy as he had previously thought. After this conversation, he decided that if things continued in the same spirit, he would be able to avoid the worst-case scenario. Meanwhile, a new day began at the university hospital. The conversation with the hero seemed to completely change Chelsea's attitude towards what was happening. As Chelsea walked down the hospital corridor, she reflected on how Sam's words had been the first thing that had truly given her confidence. When she arrived at the emergency room, she greeted the nurse, who was surprised that Chelsea had arrived for her shift so early. She immediately offered her help, which surprised the nurse even more. Then the nurse explained that a lot of work had accumulated. Approaching the computer, the nurse reported that the patient had urethral stenosis. The man had a relapse after last year's surgery and had been waiting for help for 20 minutes, while other doctors were busy. After reading the patient's name, Gino, Chelsea felt like she had heard the name somewhere before. After this, the nurse asked whether the girl could perform a clean catheterization or whether she should call another doctor. This procedure involved inserting a catheter through the urethra to drain urine and was used in patients with urethral stenosis. Hearing this, Chelsea began to worry, as 20 minutes was a very long time for a patient in such a condition. Then the girl remembered Sam's words and decided that she needed to get more practical experience working with patients. After this, Chelsea smiled and said that she would perform the procedure herself. The girl then prepared all the necessary instruments for catheterization. Taking the cart with medical supplies, Chelsea headed to the patient's room. Approaching Ward B7, the girl stopped for a moment to mentally prepare herself. She tried to calm herself down, reminding herself that she had been taught all this at university, so there was no reason to worry. Chelsea then apologized for the delay and informed the patient that she would now help empty his bladder of urine. However, upon seeing the patient, a young fair-haired guy with the looks of a celebrity, the girl was completely stunned. Chelsea couldn't believe her eyes and was literally speechless. The patient turned out to be none other than King Gino, a mega-popular idol and global K-pop star. The girl immediately blushed because on the very first morning she met a real K-pop star in the emergency room. Suddenly the young man addressed her as a doctor, bringing the girl out of her stupor. In utter despair, the boy begged to be saved, explaining that his bladder was about to burst. Chelsea imagined he had turned into a rapper, singing a song about how his bladder was going to burst. Only after this did the girl order herself to pull herself together, reminding herself that in front of her was not an idol, but a patient in need of treatment. Gino complained of stomach pain and explained that he felt better after the surgery, but now the problem has returned. Then Chelsea smiled and said that he would soon be examined by a urologist, but in the meantime, she would first empty his bladder. The young man thanked her shyly, and the intern asked him to take off his pants and lie down on the couch. However, the very moment the guy started to undress, Chelsea experienced a real shock again. She tried her best to calm herself down, constantly repeating to herself that she was a doctor and he was just her patient. Soon the young man announced that he was ready, and the girl turned to begin the procedure. But as soon as Chelsea saw the guy lying on the gurney, she froze again and screamed in despair. Burning with embarrassment, the girl tried to convince herself that it was not King Gino in front of her, but just an elephant's trunk. Meanwhile, the patient, with an exhausted expression on his face, asked the doctor to hurry, explaining that he could not bear it any longer. After this, the girl deliberately focused her gaze on one point in order to maintain her composure. Before her eyes, the design on the young man's underwear suddenly turned into a friendly elephant. Chelsea then prepared the catheter and thought that this procedure was much easier than drawing arterial blood. After this, the girl approached the patient and warned that he would now feel a little cold. The young man squeezed his eyes shut, feeling intense discomfort as the procedure began. Chelsea, however, noticed that the catheter was not passing properly, likely due to the patient's urethral stenosis. She then wondered if she had applied too much lubricating gel because her hand kept slipping. Frustrated, the girl decided to make one last attempt and pushed the catheter forward with great effort. Finally, Chelsea was relieved to see that she had successfully inserted the tube, and the most difficult part of the procedure was over. After this, she prepared to press on the patient's abdomen to help the urine flow out. However, then the girl suddenly noticed that something was moving and asked the young man not to move. It turned out that the patient had an unexpected reaction, causing the girl to scream in fright. Completely embarrassed, Gino immediately apologized to the doctor for the awkward situation. The girl then panicked when she realized the catheter was not where it was supposed to be. To her horror, Chelsea realized that this had caused the catheter to fall inside. Sam heard the scream and immediately rushed to the scene, completely unaware of what had happened. Vincent began to explain to him this whole strange story connected with Chelsea, the catheter, and the famous K-pop idol. The mere description of what had happened made Vincent feel very uneasy. He could hardly finish the story. The whole situation was so absurd. Sam put his hand on his head and thought that, although strange things happened in hospitals, no one could have predicted this. Meanwhile, Axel asked how she had managed to lose control of the catheter during such a simple procedure. The girl lowered her head and apologized for all the mess she had made. The senior doctor scolded her, explaining that patients in the urology department could experience involuntary bodily reactions. Therefore, she had to prepare a special clamp in advance. The doctor himself, realizing that he had explained everything in too much detail, awkwardly cleared his throat, trying to hide his own embarrassment. He then added that, in any case, she should have foreseen such a development. Sam watched silently from the sidelines, and Vincent remarked that Chelsea had been unlucky enough to decide to come early on this particular day. Vincent explained that Chelsea had arrived almost an hour early and had tried to do work in advance that wasn't even hers. At that moment, it suddenly dawned on the hero, and he realized that it was his words that could have caused this whole catastrophe. He clutched his hair, thinking that his attempt to prevent one medical error had ended up leading to another. Sam then asked about the patient's condition, and Vincent reported that the urologist had already removed the catheter in the operating room. He stated that the situation had become a real nightmare, as she had managed to lose the catheter inside King Gino himself. Hearing this, Sam panicked and asked if the famous idol was going to sue the hospital over this mistake. Vincent replied that it was unlikely that this would happen. He had heard that King Gino himself had apologized for his own body's reaction. He wouldn't sue over something like this, because if the story made the news, the idol would become famous as a urethra rapper. Sam breathed a sigh of relief, but still continued to worry about what had happened until the notification sounded. The signal continued, and soon everyone realized that it was Jackie scrolling through his phone. Vincent asked why he looked so pleased, and Jackie, with a sly smile, admitted that he was live streaming what was happening. At that very moment, Sam's phone started vibrating. It was Julie and George, asking what this story was about King Gino. He sighed heavily and again blamed himself for everything, realizing that all this chaos had started precisely because of the words he had spoken to the girl. Meanwhile, Chelsea called herself a complete idiot. She curled up into a ball and cried, cursing herself and repeating that she should never have become a doctor. Sam tried to calm her down, explaining that she shouldn't blame herself so much, because anyone could make a similar mistake. However, the girl immediately interrupted him and asked him not to worry about her anymore, which greatly surprised the young man. She explained that she would simply complete her internship and then choose a specialty where she would no longer have to work with patients. Not knowing what else to say, the hero again tried to convince the girl to stop blaming herself and simply not repeat this mistake again. However, Chelsea did not listen to him and continued to cry, stating that she no longer cared because her career was ruined. The guy realized that words couldn't fix anything here, so he would have to look after her 24 hours a day. Sam then handed the girl his phone number and told her that she could call him anytime she needed help. Chelsea was genuinely surprised and asked why Sam did so much for her. He was too kind. Sam immediately panicked, thinking that if the girl made another mistake, his own career would be over too. If he really wanted to survive in Yongguk, he had to prevent that lawsuit at all costs. Meanwhile, evening had come and heavy rain began to fall in the city. A black luxury car sped along the highway through the downpour. Inside the car, 4 tipsy young men were having fun, and one of them noticed that the roar of the Bentley's engine was very different from the others. Then one of the friends asked the driver if it was okay to take his father's car, and he replied that the old man had a lot of cars. The girl became alarmed and asked whether the driver even had a driver's license. The other 2 boys just laughed at her and reminded her that no high school student could have a driver's license. After this, one of them suggested that the driver step on the gas and check what maximum speed the car could reach. The young man behind the wheel smiled smugly, agreed, and prepared to accelerate. The car sped down the road at incredible speed, despite the pouring rain. The driver then began to dangerously change lanes between other cars, completely disregarding the consequences. Meanwhile, Vincent and Jackie arrived with bags, bringing cold drinks for everyone. However, after the first sip, Axel grimaced in obvious disgust. He didn't understand why they brought that particular soda at all, since it was considered bad luck in the emergency room. Hearing this, Vincent immediately remembered his superstition and instantly panicked. The man added that if the department is now overcrowded with patients, they will be to blame. Suddenly, in the midst of all this commotion, the phone at the reception desk rang. A nurse answered the phone, identifying herself as a staff member from the admissions department at Yongguk Hospital. However, just a second later, her expression changed when she heard the news of a major road accident. The nurse then clarified the location of the incident and the estimated time of arrival of the victims. Without wasting a second, Axel immediately prepared for work, as a new emergency was heading to the hospital. He took the phone from the nurse and clarified the condition of the injured, as well as their number. As the conversation progressed, the doctor's face became more and more serious. Then he asked in shock whether there really were 7 injured people. After this, chaos immediately erupted in the hospital, and the emergency room phones were literally ringing off the hook. The entire team of interns was put on full alert and awaited the arrival of the wounded. Sam's face showed genuine horror as he realized how serious the situation was about to become. Meanwhile, the can of cursed soda remained standing on the table, as if confirming that the superstition was true. Meanwhile, the scene of the accident was a real nightmare. An overturned truck lay in the middle of the road. It all started when a reckless driver made a dangerous maneuver between other cars. The girl next to him screamed in fear and begged him to slow down, but the guy completely ignored her. The car continued to accelerate uncontrollably on the wet road. Then the girl realized with horror that they had driven into the oncoming lane and screamed in panic at the driver. However, the young man behind the wheel only smiled maliciously, having completely lost touch with reality. Laughing madly, he pressed the gas pedal even harder. In just a moment, the luxury car was right in front of a huge truck that was rushing towards them. In the back seat, one of the guys completely panicked as he saw the inevitable collision. The truck driver tried to swerve, but it was too late. A head-on collision was inevitable, and a deafening roar echoed across the highway. The powerful impact caused the truck to flip over, and other vehicles began to brake, trying to avoid a massive accident. However, the wet road triggered a chain reaction, causing one car after another to crash into each other. The car was thrown far to the side by the force of the collision. Meanwhile, another car flipped over several times right in the middle of the road. The teenager's car finally stopped only after hitting the barrier hard. The car door opened with difficulty after such a collision. The driver climbed out, still in shock from what had happened. The rest of the friends also got out of the car, stunned and complaining of pain. One of them remarked that they only survived because they were driving a Bentley, while the other admitted that he was sure that the end had come for them. Suddenly, the girl called out to the others and pointed out the destruction they had caused on the road. The highway turned into a real mess. There were broken cars everywhere, and people were desperately calling for help. In one of the overturned cars, a seriously injured man was trapped among twisted metal. a human hand was visible through the wreckage of another overturned car in the pouring rain. Seeing the full scale of the disaster, the girl was completely shocked and realized that they were now in huge trouble. The others also panicked, having no idea what to do next. Then one of them shouted at the driver, asking what they should do now. However, the young man just looked at the wrecked luxury car and thought that his father would probably kill him. And then suddenly police and ambulance sirens sounded nearby, quickly approaching the scene of the accident. An empty bottle of alcohol was still lying near the teenager's car. Meanwhile, news of a traffic accident caused by drunk minors spread quickly at Yongguk University Hospital. Hearing this, one of the doctors became furious and declared that modern youth seemed to be striving to go to the next world themselves. He then asked Axel about the injured, and he confirmed that there were 7, but fortunately no one required resuscitation. Sam visibly tensed, realizing that with so many patients, the likelihood of medical error was becoming high. Vincent, however, took the situation as an opportunity to gain new experience, and Sam was confident that everything would go well for him. Meanwhile, Chelsea still looked very worried, still reeling from the recent incident. The hero then asked where Jackie was, but another doctor explained that he would only be able to handle the paperwork. Sam sighed with relief, thinking that it really was better to do without the person who could panic. Suddenly, the sound of sirens was heard throughout the hospital, and the entire medical team prepared to receive the victims. Soon, ambulance workers rushed into the emergency room one after another, delivering the first injured person. Someone reported that 11 patients had just been brought in from the scene of the accident, and the senior doctor was shocked, as he had only expected 7. The nurse reported that there were already more than 10 patients waiting to be seen in the department, and no one knew how to cope with such a workload. Axel then ordered her to apologize to the patients whose condition did not require urgent care and called the interns to him. The doctor then asked about the condition of the victims, and the paramedic reported that most of the patients were in severity levels 3 to 5. Upon hearing this, Axel stated that there was complete chaos at the scene of the accident, so the sorting could have been inaccurate. Levels 4 and 5 were assigned to people with minor pain or simple injuries that did not require immediate intervention. Levels 3 and 2 referred to more severe cases, such as breathing problems, serious injuries, or fever. Suddenly, a gurney was rolled into the department at high speed, and someone shouted that a Level 1 patient had just been delivered. Level 1 was considered the most critical and included cardiac arrest, shock, or loss of consciousness. These patients were saved first. Realizing the seriousness of the situation, the interns froze in horror. Without wasting a second, Axel ordered that the patient be taken immediately to the intensive care unit. Once inside, the resident asked about her condition. The paramedic explained that by the time the team arrived, the girl was unconscious and had lost a lot of blood. The initial bleeding was stopped, but the victim likely had other sources of bleeding. After this, the medical team placed a blood pressure cuff on the girl's arm. Soon, she also had a sensor attached to her finger to measure the oxygen levels in her blood. Axel stated that although the electrocardiogram remained normal, the oxygen saturation level and blood pressure were low. He then ordered immediate preparations for intubation, after which he instructed Sam and Chelsea to find the source of the bleeding. The main task when saving an emergency patient was to ensure oxygen supply and also to preserve blood. Every extra minute it took to stop the bleeding reduced the chance of survival by approximately 3%. Therefore, doctors needed to determine the exact location of the hemorrhage among a large amount of blood as quickly as possible. Axel asked if they had found anything yet, but Sam replied that he was still looking for the source. By this point, the tension in the room had become so intense that it was extremely difficult to remain calm and think clearly. Suddenly, Chelsea announced that she had found a wound, which greatly surprised Sam. The girl then pointed to a deep cut on the patient's left hand, from which blood was flowing non-stop. Once the source of the external bleeding was found, Axel ordered immediate pressure to be applied to the wound to stop the blood loss. Sam watched Chelsea's actions closely and noticed that the girl moved quickly and very precisely. Meanwhile, one of the doctors checked the patient's pupillary response and confirmed that they appeared normal. The senior doctor then stated that he would personally check the ultrasound results and then began the examination. The ultrasound did not show anything obvious, nor did it reveal any accumulation of blood in the heart, abdominal, or chest area. Axel then turned to Vincent and asked if the arterial blood tests were ready. Vincent replied that he was working on them. The senior doctor scolded him for his slowness, indignantly adding that he intended to finish only after the patient's death. Sam watched what was happening and did not understand what had happened to his colleague. Seeing that Vincent had completely frozen in place, Axel pushed him aside and declared that he would insert the arterial catheter himself. After the blood sample was obtained, the resident handed the syringe to Vincent and ordered him to take it to the lab immediately. Vincent, completely terrified, took the syringe with trembling hands. However, the tension was so intense that his hands began to shake, and he dropped the blood sample right onto the floor. But the next second, Sam rushed forward and managed to catch the syringe right in the air before it broke. Sam managed to save the blood sample, surprising everyone with his lightning-fast reaction. Axel became furious and scolded the intern, ordering him to finally pull himself together, while the young man only apologized guiltily. The hero realized that the situation was becoming extremely dangerous. In this state, Vincent could easily make an even more serious mistake. Vincent then turned to Sam and asked him to hand him the syringe. However, the hero looked at his face and realized that his colleague knew how to look for easy ways, but could not withstand strong pressure. Sam then stood up and announced that he would take the sample for analysis himself, asking Vincent to monitor the bleeding instead. He thought that today was the day he needed to prevent any mistakes, and to do that, he would have to work even harder. After some time, the results of the analysis were finally ready. The doctor found that the hemoglobin level was 6.8 and the red blood cell count was dangerously low. Afterwards, the senior doctor explained that such a low red blood cell count usually indicated hidden bleeding. Upon hearing this, Sam immediately concluded that the patient had internal bleeding. Axel realized that in addition to the wounds already discovered, there was another source of bleeding. The situation was extremely dangerous, as internal bleeding was impossible to see with the naked eye. For doctors, internal bleeding has always been a real nightmare, and searching for it was like trying to find a needle in a haystack. Given the urgency of the situation, the senior physician ordered an immediate transfusion of 1 liter of plasma. Soon, a lab technician entered the room with a portable X-ray machine, and the resident instructed him to take pictures of the cervical spine. The lab technician set up the machine and asked everyone to move away to avoid exposure to X-ray radiation. However, Axel ordered that the pictures be taken immediately, explaining that the patient was on the verge of death. Sam reflected that, in a normal situation, during an X-ray, all personnel were required to wear protective equipment. However, Axel suddenly noticed something strange. He then turned to the hero and asked why he was still in the room. He calmly replied that everything was fine. Sam noticed that the person received radiation even during the flight on the plane, so it was like a short trip to the island. Hearing this, Axel only smiled awkwardly and wondered if such things could really be compared. Despite this, the most important thing now was to save every drop of blood the patient was losing. Sam did not act out of a sense of duty or self-sacrifice. For him, it was a complete immersion in his work. The resident looked at Sam silently with a serious expression on his face. Suddenly, a beep sounded throughout the room, and the X-ray technician announced that the examination was complete. After this, the senior doctor approached the machine and began to carefully study the images that had just been received. Suddenly, his eyes widened as he finally discovered the source of the problem. The doctor then pointed to the screen and stated that the injury was in the pelvic area, much to the surprise of the entire team. An X-ray showed that the patient's pelvis was fractured and displaced as a result of the powerful impact during the accident. Immediately after this, the senior doctor ordered that a pelvic bandage be urgently brought in and that orthopedists be called immediately. The medical team immediately began placing a fixing device around the patient's pelvis. The bandage was then tightened to compress the pelvic bones and thereby reduce internal bleeding. At the same time, doctors continued transfusing blood and solutions, trying to stabilize the girl's condition as quickly as possible. Axel was relieved to see that the patient's blood pressure had finally begun to rise gradually. Meanwhile, the heart monitor signals continued to sound throughout the ward, and the girl herself was still lying unconscious. Soon the resident confirmed that the blood pressure, pulse rate, and blood oxygen saturation levels were already within normal limits. After this, the senior doctor inquired about the patient's condition, and Sam reported that the girl had still not regained consciousness. He then walked over to the gurney to examine its condition more closely. He looked closely at her face, and at that moment, one of the patient's eyes slowly opened, which greatly surprised Sam. A wide smile immediately appeared on the young man's face, and he joyfully reported that the girl had begun to regain consciousness. Hearing this, the senior doctor breathed a sigh of relief and noted that they had finally overcome the most dangerous stage. Axel then asked if a CT scan should now be performed, and the professor agreed, reminding him not to stop the blood transfusion. After this, the senior doctor ordered a CT scan of the brain first, and then an examination of the chest, abdomen, and pelvis. Meanwhile, Sam leaned against the wall, feeling a huge sense of relief that this time a medical error had been avoided. He wondered if his Vincent had made a mistake out of panic. The delay in discovering it could have cost the patient her life. After thinking about everything that had happened, Sam realized that they had managed to successfully save the most seriously ill patient. However, a moment later, the young man remembered that there were still 10 more victims waiting for them ahead. Sam knew full well that he couldn't relax until the very end of his shift, so he immediately ran back into the very center of the chaos. Meanwhile, the emergency room had completely turned into a nightmare, with patients' screams echoing everywhere. Everything around increasingly resembled a battlefield, and after the arrival of doctors from orthopedics and neurosurgery, the department became even more crowded. The situation became more complicated when relatives of the victims began arriving at the hospital, causing complete chaos. Sam and Chelsea were dressing a wound on one of the patients while discussing the crazy influx of casualties. Sam thought that this day would certainly go down in the history of his life because he had never encountered such crazy events. Chelsea admitted that the whole day had been a real lesson for her, which noticeably surprised Sam. The girl explained that when she saw so many seriously injured people, all her previous worries seemed insignificant. Hearing this, Sam praised the girl, noting that she did her job well and did not make any more mistakes. In response, the girl thanked him and admitted that his words of support, which he had told her earlier, had really helped a lot. Sam joked with a wide grin and asked if she still hated working with patients. However, Chelsea immediately objected, explaining that she still hated it and was still very afraid of such situations. However, the girl stated that, despite her fear, she was still obliged to do what was necessary. Seeing such a change in his colleague's attitude, Sam thought that at least today he would no longer have to worry about Chelsea. Suddenly, an angry voice rang out throughout the department, demanding to know who was in charge here. A few seconds later, an angry man burst into the department and demanded that the department manager be called immediately. The nurse immediately approached the couple and asked what the problem was. However, the man, his face distorted with rage, immediately accused the staff of negligence. He then pointed to his son lying on the bed and demanded to know why he had not yet been treated. Vincent, who was standing nearby, quietly whispered to Sam that it was this boy who was the culprit of the accident and received practically no injuries. Sam was outraged to realize that the parents of the man who caused the accident were acting as if everyone owed them something. Meanwhile, the teenager's father threatened to sue the entire hospital staff for negligence. The nurse tried to calm the man down, explaining that screaming like that was not allowed in the emergency room. Then a woman intervened in the conversation, outraged that she had been told there were more seriously ill patients. She continued to complain, arguing that they should have treated the ones they could deal with more quickly first. Having completely lost his composure, the man pushed the nurse, causing her to cry out in pain. Seeing this, Sam shouted for someone to call security immediately. However, suddenly a voice was heard demanding that what was happening be stopped. It was Chelsea who looked genuinely angry. The girl stood resolutely in front of the man, like an angry hamster, ready to defend her comrades. Sam was completely shocked to see such anger coming from his colleague. The man looked at Chelsea with disdain and asked who she thought she was. However, the girl, with unexpected boldness, declared that his son was far from the only person whose life had value. Chelsea pointed to the other victims and explained that each of these wounded people was also a child to someone. After this, the girl directly said that the reason for everything that happened was their son's irresponsible act. The couple were so shocked by this accusation that they were unable to respond immediately. However, Chelsea continued and stated that they should have been the ones on their knees asking for forgiveness. The teenager's mother literally turned red with rage, not believing that she dared to talk to him like that. Losing her composure, the woman tried to hit Chelsea, demanding to know how she dared to answer her like that. Seeing that his colleague was about to be attacked, Sam cried out her name in despair. However, Chelsea was not at all scared and immediately began to refer to Article 12 of the Emergency Medical Care Act. The girl explained that any attack or obstruction of doctors' work could result in a punishment of up to 5 years in prison. After these words, the couple froze in place. The man flared up again and indignantly declared that he did not understand how the intern dared to threaten the patient's relatives. The woman then became angry again and said that she would definitely file a complaint against the Yongguk hospital employee. However, Chelsea responded quite calmly that the woman could confidently file a complaint, which noticeably surprised her. The girl then formally introduced herself as an intern at Yongguk University Hospital and gave her name. Her confident voice completely deprived the spouses of the opportunity to object. After this, the man threatened that he would not leave it that easily. However, Chelsea calmly replied that he should not have left things as they were and advised him to definitely file a complaint. The girl then pointed the couple to the exit and demanded that they leave the assistance area, explaining that they were interfering with the staff's work. Sam watched his colleague's behavior with admiration and wondered if Chelsea had always had such a bold side to her character. He then approached the girl and asked if she would be okay, as the man was indeed going to file a complaint. In response, Chelsea calmly stated that in her entire life, she had never backed down just because someone had connections. Hearing these words, Sam finally understood the dignity of being a representative of the Yongguk royal family. At that moment, Axel suddenly appeared with an expression of undisguised irritation on his face. The resident demanded to know why they were making such a fuss, since there were many patients around. Chelsea immediately bowed, apologizing to the senior doctor. Axel then gave the girl a slight nudge and ordered her to return to the patients immediately. However, as soon as he turned away, he discreetly gave her a thumbs up, thereby approving of her action. Axel then patted the interns on the back and told them to hurry up, reminding them that there was still a huge mountain of work ahead of them. Chelsea gave a small smile. Sam looked at the girl with a smile, feeling sincere pride and admiration for her courage. Meanwhile, several hours passed and night fell over Yongguk Hospital. After treating another wound, the doctor announced that the procedure was complete. Axel began discharging patients with minor injuries, and they sincerely thanked him for the help he provided. The resident asked Sam if they had finished treating all the victims in that accident, and he confirmed that the work was complete. Sam found the hospital to be an incredibly dynamic place and admitted that he hadn't noticed a similar rhythm in therapy. Hearing this, Axel replied that everything was quite natural, because the emergency department was not called that for nothing. Here, patients were constantly screaming in pain, and people on the verge of death could be admitted at any second. However, there was a special feeling in the emergency room that could not be found in any other department. Axel explained that saving a dying man and returning him to his family was a feeling that could not be described in words. He then stated that the ability to change a person's destiny was the real pride of an emergency medicine physician. These words sank deep into Sam's soul. Noticing the intern's reaction, Axel put a friendly hand on his shoulder and asked if he was interested in such work. Sam replied with a smile that he would be truly grateful if he were accepted into any department at all. He then added that it would be an honor for him to work with Axel and that he would definitely think about the offer. However, the resident did not like such flattery, so he slapped him on the back and declared that this was enough. Axel again ordered Sam to hurry up and take care of the remaining patients, reminding him that he was behind schedule. After the storm finally passed, the emergency room suddenly became unusually quiet. However, Sam still felt a strange sense of unease, as if he had forgotten something really important. Then the hero noticed his colleague Vincent, who was sitting at the computer, and immediately called out to him. Sam explained that since all the injured had been dealt with, they could now split up and deal with the regular patients. Vincent added that while they were dealing with the accident victims, Jackie had managed to see several more patients. Sam was genuinely puzzled, because before this, he had believed that his colleague could not work fully due to an injured hand. Vincent then explained that he had recovered much faster than expected and had already had his cast removed. It was then that Sam finally realized where his bad feeling had come from. He realized that he had been so focused on the accident victims that he had completely forgotten about the patients who were already in the department. At that moment, it finally dawned on Sam that the real problem wasn't Chelsea or Vincent, but Jackie. Then he opened the list of completed procedures. He noticed that although Jackie had seen several patients, none of the cases seemed particularly complicated. However, when Sam noticed one particular procedure on the list, his eyes widened in horror. The discussion was about thoracentesis, a procedure in which a needle was inserted into the chest to remove excess fluid from the pleural cavity. The patient was a 70-year-old man who complained of severe shortness of breath. Without wasting any time, Sam walked up to Jackie and asked him point blank if he had made any mistakes today. The young man just looked at him in bewilderment and asked why Sam had suddenly started picking on him for no reason. Jackie stated that he had been named the best intern several times before, after which he advised Sam to mind his own business. Sam then asked if he had taken a follow-up X-ray after the procedure, and Jackie replied irritably that, of course, he had. However, almost immediately he admitted that he had not yet had time to look at the results of the photo, and upon hearing this, Sam panicked. Jackie indignantly asked if Sam really thought he was the only one working hard today. However, the protagonist's unpleasant premonition only intensified, and he ordered Jackie to immediately open the X-ray. Grumbling with discontent, he nevertheless sat down at the computer and displayed the image on the screen. But a second later, his facial expression changed completely. The image clearly showed that the pleural effusion had not disappeared, meaning that the procedure had failed. Jackie noted that this was why the puncture had failed to remove almost anything, and suggested simply repeating the procedure. However, after seeing the image, Sam asked Jackie if he really hadn't seen the main problem in the picture. He pointed to the X-ray and explained that there was a huge pneumothorax on the opposite side of the pleural effusion. These words completely stunned Jackie, and after a moment the meaning of what he saw finally dawned on him. The hero explained that the fluid was in the right lung, but the pneumothorax occurred in the left. Then Sam looked at his colleague with horror and asked if he had really punctured a healthy lung instead of a diseased one. Jackie was completely numb and just continued to sweat, unable to utter a word. Sam asked where the patient was now, since the puncture of the opposite lung meant that the only working lung was damaged. However, before Sam had gone far, Jackie grabbed him by the robe in desperation. Then the young man began to beg Sam not to tell anyone anything, because if they found out about it, his grade would be ruined. Hearing this, Sam slowly turned around and looked at his colleague in complete shock, not believing his own ears. Jackie explained that after the incident with the hand, everyone was already looking at him sideways, so he asked to simply hide the incident. Sam's face instantly darkened, and he had a hard time containing his anger as he asked what exactly the bastard had just said. Smiling nervously, Jackie suggested just leaving it as is, since the pneumothorax seemed small. This ridiculous proposal completely infuriated Sam, and he loudly called his colleague a complete idiot. This whole argument took place right in the middle of the nurses' station, so everyone around immediately turned their attention to them. Sam slammed his palm down on the table, finally losing his patience. He screamed that he didn't care what grade the intern got because the patient could have died because of this mistake. Sam looked at Jackie with undisguised fury, while the latter literally froze with fear. Sam then grabbed him by the clothes and demanded to know where the patient was, since 30 minutes had already passed since the x-ray. Without waiting for an answer, Sam quickly rushed to look for the elderly man before it was too late. Soon the hero reached the required chamber. There he saw an old man lying on a bed with an expression of unbearable suffering. The man gasped for air, had difficulty breathing, and held his hand to his chest. With great effort, the patient called the doctor and reported that he could not bear it any longer. He gasped as he said that he couldn't breathe, and those words instantly sent both interns into a state of alarm. The next second, the man completely panicked and began to fight for every breath. The scene they saw completely shocked both young doctors. Sam quickly glanced at the monitor and saw that his blood oxygen saturation level had dropped to 73%, dangerously low. Then he realized that the monitor's alarm had been sounding all this time, but because of the chaos, no one had heard it. Realizing the urgency of the situation, Sam ordered an oxygen mask to be prepared and immediately rushed to the patient. While he tried to save the man, Jackie continued to stand motionless in place, completely numb with shock. Sam shouted at him to show Axel an x-ray immediately, and to call specialists from the thoracic surgery department immediately. Only after this did the intern finally come to his senses and run out of the room, and Sam watched him go with a heavy look. It was at that moment that he finally realized the truth. Everything that was happening now was exactly the future he had seen in his dream. Sam thought that if they had been even a little bit late, the man would have been impossible to save. The hero realized that the patient had developed pneumothorax, a condition in which air accumulated in the chest. The only way to get the lungs to work normally again was to remove this air as quickly as possible. So Sam asked the nurse to urgently bring him a 16-gauge needle, and the woman complied with his orders without delay. Soon, the nurse handed Sam all the necessary materials for the emergency procedure. The hero then took a seat next to the patient and prepared to perform the aspiration. However, when Sam picked up the needle, he paused for a moment, overcome with doubt. He wondered if he really was the one who should perform this procedure, since before this, he had only studied it from books. A thought flashed through Sam's mind as to whether he should have waited for a more experienced doctor. The young man understood that if he made a mistake, it would be extremely difficult to get a good grade for this month. Moreover, in the worst case, he could become the main culprit in the trial. However, the patient's heavy wheezing brought Sam back to reality, reminding him that a human life was at stake. For a moment, the young doctor looked at the man in silence, trying to make a decision. Then Sam narrowed his eyes and decided that he would not let the patient die. He finally realized that there was no more time left. Sam realized that for the elderly man, every extra second in this state could be fatal. Surgeons will be able to get here in at least 10 minutes. If nothing is done right now, it will be too late to save the patient. So Sam remembered everything he had once studied, and then prepared to insert the needle above the nipple, along the upper edge of the rib. With impressive precision, the hero carefully inserted the needle, piercing the patient's skin. The man involuntarily winced in pain. However, Sam continued to carry out the procedure with full concentration. After a moment, he realized that the needle had not gone in deep enough, and he carefully pushed it further. Sam then slowly advanced the needle to the desired depth and observed the patient to check if the procedure had worked. Suddenly, the distinctive sound of escaping air was heard throughout the room, indicating that Sam had hit the right spot. After this, the patient's breathing gradually began to even out, and the pressure in the chest decreased. As a result, the man was finally able to breathe much more calmly. Sam looked at the monitor and saw with a relieved smile that his blood oxygen saturation level had risen to 89%. However, the very next second, his thoughts were interrupted by Axel's loud cry. The resident was on the phone and informed his interlocutor that the patient would likely need drains installed in both directions. But then his gaze fell on the needle sticking out of the man's chest, and the doctor froze in amazement. The next moment, Axel became furious, shouting Sam's name and demanding to know what exactly he had just done. The resident then grabbed him by the gown and began to scold him for performing an emergency procedure on his own. However, after glancing at the monitor, the doctor suddenly saw that the blood oxygen saturation level had increased significantly. Without wasting any time, Axel ordered a syringe and a special valve to be brought to him, and the nurse immediately handed over the necessary instruments. The team then carefully moved the patient. The resident told Sam to hold the valve tightly. Axel then began using a syringe to gradually remove all the air that had accumulated in the man's chest. All this time, Sam watched his mentor's actions very carefully. After the patient's condition was stabilized, the resident approached the man and asked how he was feeling. The patient reported that his wife left the room briefly, after which he suddenly stopped breathing normally. The elderly man then added that he was sure he was about to die and was unable to even call anyone for help. With a gentle smile, Axel reassured the patient, explaining that everything was now fine and there was no need to worry anymore. It was at that moment that the man's wife ran into the room. She was terribly frightened and immediately tried to find out what had happened. The woman hurried to the bed and saw with great relief that her husband was alive. Sam watched the scene silently from the sidelines and thought that the patient had almost died because of a completely ridiculous mistake. Unexpectedly, the older man thanked Sam, which took him completely by surprise. He admitted that he was already sure of his death, since he could not breathe at all, but now he felt much better. After these words, both Sam and Axel simultaneously fell silent. At that moment, another doctor entered the room and called Axel. The resident immediately turned to him. It turned out to be Martin, a resident in the thoracic surgery department, who had arrived to help with the case. He praised Axel for his good work and informed him that their surgical team would take care of the patient from now on. When the situation was finally under control, Axel turned his back on the interns, and then he suddenly called them to follow him in a serious voice. The group of interns instantly turned pale, fully aware of the scolding that awaited them. Finding himself in a separate room, Axel looked at them silently for a long time. The resident, crossing his arms over his chest, prepared for a long lecture. All the interns silently lowered their heads, feeling both shame and fear in front of the senior doctor. Axel angrily declared that in all his time on the job, this was the first time he had seen such a stupid mistake in the emergency department. Then he finally lost it and demanded to know how they even dared to call themselves Yongguk's interns. Sam understood perfectly well that Jackie was the real culprit of what happened, but he decided to remain silent. Axel explained that the patient's second lung was filled with fluid, but the interns still punctured the only healthy lung. He shouted that by such actions they were trying to kill the patient and declared that they were more like murderers than doctors. Axel added that they should not only feel sorry for what happened to the patient, but also feel ashamed in front of their colleagues. After a brief silence, the doctor turned and addressed Jackie directly. The young man shuddered in fear and approached the boss in fear. Axel warned him not to get cocky just because his cast had been removed and transferred him back to processing patient consents. Completely dejected, Jackie just silently lowered his head and agreed with this order. Soon the resident dismissed the rest of the interns, but unexpectedly asked Sam to stay. The hero was surprised, as he did not understand at all why he was left behind. When they were alone in the room, Axel turned to Sam. He said that he wanted to ask him one question. The man asked why the intern performed the needle aspiration on his own, without even consulting anyone in charge. Sam didn't know how to answer such a difficult question. The resident then warned him to think carefully about his answer, since his final grade could depend entirely on it. Under intense pressure, Sam swallowed hard, knowing full well that his future was now on the line. Sam apologized for acting on his own, but explained that he considered the situation critical. However, Axel continued to insist and ordered the protagonist to explain himself. He was interested in what he meant by the criticality of the situation. Sam explained that he had learned that if tension pneumothorax is not treated promptly, it can lead to cardiac arrest. However, the resident still continued to demand further explanations from him. Sam explained that he didn't notice the pneumothorax until 30 minutes later, and when he arrived, the patient's blood oxygen had dropped to 73%. Moreover, the patient was elderly, and since he was an old man with problematic lungs, Sam realized that there was not a second to lose. At this point, an awkward pause hung between the men while Axel assessed the protagonist's explanation. Sam himself looked at him with apprehension, suspecting that he might have said something wrong. At that moment, the resident only sighed, but, apparently, had already calmed down. Moreover, to the protagonist's surprise, he praised him because he had discovered someone else's mistake and provided assistance in time. Axel asked him to forget that he had scolded him, since even hundreds of thanks would not be enough for him. Still, he shouldn't forget that he was an intern, so he shouldn't do anything he couldn't be responsible for anymore. He asked the protagonist not to make decisions on his own while he was an intern. After that, Axel patted him on the shoulder and asked him to get back to work. When their conversation was finished, the hero bowed respectfully to him, and the intern himself headed to his desk. However, before Sam left, the man called out to him again. He gave him a thumbs up and told him that he would get the highest possible grade this month. When the main character heard this, genuine surprise appeared on his face. Axel said that the principal and professor had already given the final grades, but if he intervened, Sam would get an A+. However, seeing the thoughtful expression on Sam's face, he began to think that he didn't need it. The hero explained that perhaps Axel shouldn't have said that, and then the man realized that he had indeed said too much. After this, he turned away and again asked the protagonist to return to work. Sam bowed respectfully to him again, then said goodbye and left the office. Once he was in the hallway, he could finally catch his breath and think about what he had just heard. The hero looked up at the ceiling and repeated Axel's words in his head again. He could no longer hold back. He even cried with happiness, realizing that he was finally able to change the future with his own hands. Sam knew he'd saved the patient, earned an A+, and, to top it all off, earned Axel's trust. He noted to himself that changing the future with his own hands was simply amazing. Sometime after this, Axel and Martin went to see the patient. However, the woman who came to him asked them in surprise what they had done to her father-in-law. She was horrified to learn that they had punctured a perfectly healthy lung and put him at risk. Axel apologized to her and said it was entirely their mistake, but the woman said it was grounds for legal action. But the patient stopped her, saying that everyone was confused by the accident, so he did not hold a grudge against them. The old man said that doctors are also people and can also make mistakes. There was nothing wrong with that. The main thing was that they cured him. Martin said he didn't have to worry about it because he would treat him like his own father and give it his all. After this, Axel apologized again and said that nothing like this would happen again. Meanwhile, the story moved to the emergency medical center. There, Jackie was sitting at one of the computers, nervously biting his nails as he stared at the screen. The doctors passing by looked at him with distrust, since they all knew perfectly well that he had disgraced their entire department. They started making fun of him, saying that he probably thought his heart was on the right. At that moment, a man approached Jackie from behind, and the young man even jumped in his chair out of surprise. It turned out to be Axel, looking very angry, and he said he had something to talk to him about. The expression on his face was so frightening that Jackie simply froze in place. However, he still obeyed, and soon they went out together onto the landing to talk in private. Axel was still clearly very angry at the intern for making such a shameful mistake. He said Jackie should have considered himself lucky because they would have been in big trouble after that, even though the patient didn't file a lawsuit. Axel admitted that he really wanted to punch Jackie in the face, but he held back with all his might. He announced that for this, the young man would receive the lowest performance rating for an intern that month. Jackie was shocked and began to ask what he had done to deserve this, because if you think about it, Chelsea was just as guilty. Axel said that, of course, doctors are human too and make mistakes, but the problem was what he did after that. When Chelsea realized her mistake, she contacted another department and tried to save the patient until the end. At the same time, Jackie wasn't even doing his basic duties and was encouraging others to pretend that he wasn't. Axel also said that he heard that Jackie had good grades at university, but he didn't care about it. He stated that, in his personal opinion, Jackie was a completely lousy doctor. These words struck the young man, and he did not know what to answer. Axel added that he was only at the beginning of his internship, so he would still be able to get good grades in other departments. He told him to use the remaining time well, to think everything through, and then left the intern alone. Jackie was very angry with Sam because he got a lower grade than a boy from a rundown regional school. He punched the wall with all his might and cursed, but the blow was so strong that he broke his wrist. He ended up needing another 2 weeks to recover, and as a result, his internship was a complete failure. Sometime after this, Martin decided to talk to Axel a little and asked how he was doing. He said that the patient's daughter-in-law was a lawyer from a large firm, so they almost got into trouble for negligence. Axel admitted that when he thought about this guy, Jackie, his blood even started to boil. Martin asked him with a smile if the emergency department really trained its interns that poorly. However, the man said he would like to see how the interns handle cardiothoracic surgery. All his problems this month have been because of these interns, first the non-latrin thing at Chelsea's, and now this. That situation was very dangerous. The patient's heart could have stopped, and although it was a grave mistake, he received help in time. Martin then noted that, despite everything, Axel still had a very keen sense of smell. He did the right thing by performing the puncture in an emergency situation, which was to be expected from an ace of emergency medicine. However, Axel explained that it was not he who carried it out, but an intern from their department. Martin even thought that his colleague was lying, since an intern after 2 months could hardly have come up with that. But Axel said that it was true. He had just finished his internship in therapy last week, but he had talent. At that moment, the men suddenly heard someone's voice, and its owner immediately became interested in this intern from therapy. As it turned out, it was Charlie. He approached the table and asked what the Donbon brothers were doing there. Martin asked him the name of the intern who had prepared the ECMO in advance that time, and Charlie said his name was Sam. At that moment, an awkward silence fell between the men as they realized the whole truth. Axel laughed and said that in that case, this guy could be considered real gold. From their reactions, Charlie realized that this guy seemed to be doing pretty well in the ER too. Martin thought about this Sam and decided that he was definitely an unusual guy, judging by the patient last month. However, it was too early to draw a definite conclusion. Perhaps he was simply twice lucky. However, no one understood what would happen if something like this happened again, and they became increasingly curious about who Sam really was. At this point, each of the residents began to think about trying to lure Sam to their department. At that moment, the main character sneezed loudly. He didn't understand why he suddenly sneezed, because it was already spring outside, but it was still so cold. Sometime after that, Sam went to his home to finally rest after such intense shifts. However, he was not allowed to sleep properly, as the stomping and hissing of pots could be heard everywhere. Apparently, there were quite a few people in their house right now, and no one cared that Sam was sleeping. When the protagonist stood up, he saw that the door to his room was slightly open. Realizing that he wouldn't be able to sleep normally anymore, he decided it was time to go down to the guests. He thought about coming home for the first time after 2 months of internship at Yongguk University. When the hero came down, he was immediately greeted by his older sister Sophie, and the hero asked her what time it was. The girl said that it was now 1 o'clock in the afternoon, and noted that he was very tired, and Sam thought that Sophie had always been like a mother and an angel to him. And at that moment his thoughts were interrupted, as someone came up and sharply pulled him by the cheek. As it turned out, it was his second sister, Carla, and, unlike Sophie, the protagonist considered her a real devil. At that moment, his niece ran up to him and grabbed his leg, asking why he woke up so late. When the hero looked around, he noticed his sons-in-law around him, who were also very happy to see him. The men were worried that he might be bullied at the hospital, but Sam said everything was fine, he was just too busy. Sophie said he woke up just in time and suggested they all eat together, and then Sam asked her where Dad was. As it turned out, their father was busy preparing food in the kitchen. With incredible fury in his eyes, he cut up the fish. All his movements were so practiced and skillful that everything was ready in just a couple of seconds. Soon he presented the entire family with perfectly sliced sashimi. When everyone was gathered at the table, he smiled and invited everyone to begin eating, and the others thanked him for the food. One of the men said he had heard that Sam had distinguished himself this month, but the hero said he was still an intern. The man was surprised by this, because he thought that interns were hired because their company usually hired them right away. The hero's father said that in any case, he was happy with the way things were going for him, because it was all thanks to that tuna eye liqueur. However, another man claimed that it was actually that rare deer blood liqueur that was to blame. At this moment, the main character thought and remembered what kind of liqueur his father was talking about. About a week before the internship began, he placed in front of him a glass of liquid with a fisheye floating in it. The man said it was golden tuna eye liqueur that he had saved for a special day, so Sam had to drink it. However, the hero experienced real horror when he looked closely at this dead eye. He claimed that there were parasites floating in it and that the eye was yellow because it had gone bad, which enraged his father. Then he turned to his sons-in-law and asked them to help him and stop Dad. However, they themselves were already drooling over this rare liqueur and dreaming of trying it. Then each of them offered another drink, made by their parents with horrible ingredients. 3 men began shouting at the main character in turn that he absolutely had to try each of their drinks. When Sam's father realized that his son was not going to agree peacefully, he ordered his capture. While the other 2 held him by the arms, the man took the glass and forcibly poured the liquid into his son's mouth. After this tasting, the protagonist developed a stomachache, and on his first day of work, he could barely make it to the hospital. Now he thought about the fact that his ability to see the future manifested itself precisely during that period. When everyone finally went home, the main character was finally able to breathe a sigh of relief. He lay down on the bed, thinking about how calm and pleasant it was at home, and dreaming that Monday would never come. And then suddenly, Sam thought that he finally had a quiet weekend, and he needed to spend it usefully. So he pulled the blanket over himself and decided that he would take this chance to get a good night's sleep. He was so comfortable lying in his bed that it seemed as if he could sleep for 10 million years. However, his peace was broken as his phone suddenly rang loudly. As it turned out, it was his colleague George, and the hero immediately thought that something had happened in the hospital. When he picked up the phone, George said that Sam needed to help him immediately. The hero immediately jumped out of bed and asked what had happened, thinking that he would not have a quiet weekend. However, to his surprise, George simply said that one person did not show up for the meeting. He explained to the disgruntled protagonist that they were supposed to have a 3-on-3 meeting. He explained that his friend was supposed to come too, but the girl caught him, so he couldn't come. Sam was clearly unhappy about being bothered about this, but for George, it was a really big deal. So the hero went back to his bed and said that he understood him perfectly, but chose to sleep. Then George said that if he came to the meeting today, he would take care of all his physical therapy for a year. But the main character wasn't interested in this, so he was already reaching for the end call button. George tried to stop him, saying that they had been looking forward to this day and that it could be considered their last meeting. His colleague Vincent was already very old, and perhaps he simply would not live to see the next time. Finally, Sam agreed and asked where they were meeting. George was very happy about this and named the place and time of the meeting. Finally, he asked Sam to dress decently, but the hero stated that he didn't really have any clothes. Soon evening came, and the main character went to the right place. He stood near Gangnam Station, waiting for his friends, who were supposed to arrive any minute. Looking over his clothes, he noted that they looked quite good, although he had chosen them without looking. Sam reflected that this was his first meeting since his freshman year of college, and he was already feeling a little awkward. At that moment, his friend approached him, and Sam immediately greeted him joyfully. However, when he took a closer look at what he looked like, he was in real shock. George and Vincent looked absolutely ridiculous in the clothes they were wearing. When Sam asked why they dressed like that, Vincent said that white best reflected his profession as a doctor. He said that in the group of doctors, everyone said that you need to put on a gown to collect the image. Sam then asked what was wrong with George, and he said he asked at the sports group and was advised to emphasize his muscles. However, the protagonist was horrified that he was going to go into this. He felt real horror at the realization of how this horrific meeting would go, so he convinced his friends to change their clothes before going out to meet the girls. The young people listened to him and finally brought themselves back to normal, finding a clothing store at the last moment. However, they themselves were puzzled as to why Sam had forced them to change their clothes, since, in their opinion, their previous images were good. However, Sam stated that in their case, they should have dressed not well, but at least not strangely. And then suddenly the guys noticed that the girls were late. Vincent even started to get angry and thought that they would not come at all. However, at that moment, they suddenly heard female voices asking if they were really from Yongguk Hospital. The girls apologized and said that they were in a hurry and called a taxi, but the traffic jams were just terrible. When the young men looked at their companions, they froze in surprise for a moment. George and Vincent had already begun to imagine how they would marry the girls they liked. Then George said that they had just arrived too, and added that they had already found a place with a cool atmosphere. At that moment, one of the girls walked past the main character and glanced at him. When she noticed that Sam was looking at her too, she looked down awkwardly and smiled a little. Sam was very glad that he agreed to come. His life was so boring, but at least today he would be able to remember. However, something happened that he did not expect at all. The space around him began to distort again. The hero turned around when he heard someone's terrifying scream right behind him. He realized that it was coming from somewhere on the balconies of the building that was directly behind him. Literally the next moment, one of the balconies collapsed, and the people who were there began to fall down. The destruction was colossal. The building began to collapse completely along with all the beams and boards. The protagonist froze in horror, realizing that this was another vision of his future. He saw a report from the scene that said a third-floor terrace of a building near Gangnam Station had collapsed. Passers-by underneath and guests sitting on the terrace were injured. In total, there were about 10 victims, 1 dead and 1 person in critical condition. It was reported that illegal parking on the streets around the station made it difficult for ambulances to arrive. An emergency room doctor said 1 patient was unconscious due to severe bleeding, and 1 died after cardiac tamponade. He said that if help had been provided faster, or if they had been taken to hospital sooner, this could have been avoided. Sam soon came to his senses and noted that it was very strange to see the prediction at such a time. He noted that if it was Gangnam Station, it was not far away, and it happened around 9 o'clock in the evening on Saturday, that is, today. At that moment, George suddenly turned around and asked the hero if everything was okay with him. However, Sam replied that he was fine, deciding not to let him in on it. He still couldn't believe all this, because some of his visions showed the future several days before the events. Soon after, the guys went to the establishment where they had reserved a table and ordered drinks. The girls noted that this was the first time they drank with doctors, since all the doctors they had met said that drinking was bad. They heard that the men worked at Yongguk University Hospital, which was considered the best hospital in the country. Soon after, the company brought out appetizers that looked very appetizing. But at that moment, Vincent suddenly stopped the girls and told them not to start eating. The man told them to leave the cuttings for him, as he was a sausage specialist at the university. One of the girls asked George what his specialty was, but he replied that they were interns for now. The girls said they had also been interns for 2 years, but many finished after 6 months, although it was difficult. They said that during long flights, they only had time to close their eyes, and their bunks were in the back of the plane, but it was very cramped. They had to maintain their uniform and hair, and be aware that they were being watched even in their sleep, so it was very difficult for them. George said the doctors also slept little, especially during their ER internships, where they had to work 24 hours a day. However, Vincent said that patients needed the help of doctors, so they always gave their all. Soon after, the group decided to drink to their internship and to all interns in Korea. While everyone else was having fun, the main character was constantly checking the news, trying to figure out where the incident would take place. Although he looked for bars with terraces near the station, he couldn't find anything special. The accident was supposed to happen at 9 p.m., and if that was true, there was about an hour left. This information drove the hero crazy. He didn't understand why he saw the future, but didn't even know the date and time. And then suddenly he saw that one of the girls handed him a glass of beer. She asked Sam what was wrong because he kept looking at his phone and assumed he didn't like them. However, Sam quickly laughed it off and said that this was not true. He just received an urgent message. The girl said that doctors really do need to be on guard all the time, and added that her relative was also a doctor. Then she suddenly remembered that Sam had already said his name and asked if it matched its meaning. The hero replied that his family owned a fish restaurant and his father wanted the fish to always be fresh. At that moment, the girl laughed, not believing that he was named after the fact that he was the son of the owner of a fish restaurant. The protagonist also laughed in response, saying that no one remembered his name when he introduced himself. The girl said that she could not forget him and asked if he remembered her name. The hero replied that her name was Sally. The girl said that this was the correct answer and asked him to remember her name, after which he suggested they clink glasses. The main character felt very awkward and even offended that such a terrible incident had to happen on such a happy day. Soon after the boys had spent the evening, they went outside to get some fresh air. Vincent noted that they had a very good time, and it seemed to him that the girls were very pretty and open. George noted that he liked Inna because she was elegantly dressed, while Vincent liked Mina because she was simple. The men also noticed that Sam was chatting incessantly with Sally and assumed that they had even started dating. Vincent couldn't hide his joy at how well everything had gone and was determined to continue communicating with Mina. He then asked where they were going next, and George replied that it was now 8:30, so they still had time. While they were discussing where to go next, Sam thought about the fact that there was only half an hour left before that event. He saw in a vision that the victims were bleeding heavily, they had to perform cardiac tamponade, and one person even died. The hero didn't understand what to do in this situation, especially considering that there was so little time left. Suddenly, someone's gentle hand touched his cheek and immediately brought him back to his senses. It was Sally. She noticed that Sam looked a bit pale and asked if he was okay. However, the hero only laughed it off and said that he hadn't drunk alcohol for a long time, so it went to his head. In response, the girl just smiled and did not ask any unnecessary questions. Her beautiful smile brought a deep blush to the protagonist's face. Meanwhile, his friends had already gotten into the taxi and started calling him, as the car was already ready to go. And then suddenly the hero asked Vincent where the bar they were going to was. But before he heard the answer, he felt Sally gently tug at his clothes. The girl looked at him with a smile and suggested that they split up and go have some fun somewhere together. At that moment, the main character froze. He understood that he would really like to agree. If this was exactly what he thought, then this beautiful girl was literally asking him out on a date. Sam suggested that she had arranged it with her friends and stayed with him on purpose, and Sally confirmed this. She admitted that she liked Sam, and since he was very busy, they would hardly be able to see each other very often. She said she wanted to clear things up today and asked the protagonist what he thought about it. Sam knew that even if he refused, he was unlikely to find the right bar in such a huge area, and he didn't even know if that would happen. Besides, he was just an intern, and the first aid he practiced on dummies wouldn't have helped him with severe bleeding. The hero tried to convince himself that he couldn't change anything. Sometimes he just had to give up, otherwise he wouldn't last long. Moreover, Sally had hoped that he would go with her, and he did not want to let her down. It was a difficult choice for him, and for a while, the protagonist was silent, thinking about what to do. Finally, he turned to Sally and apologized, saying that he had actually come so that there would be 3 of them. He stated that he accepted her feelings, but he had no time for a relationship. After this, he bowed respectfully to the girl and said that it was time for him to go. Sam ran off towards the bars, declaring that something really urgent had happened. The girl could not utter a word in response. She was very shocked by such a reaction. Sam thought that there were 20 minutes left, that it was a 3-story building with a terrace in the gateway, where the ambulance could not get through. The protagonist understood that if he didn't find this building, then someone would definitely die today. Meanwhile, in the building where the tragedy was supposed to take place, the party was still going on. People who suspected nothing came out onto the terrace and leaned against the fence. Workers noted that visitors had recently begun to complain about hearing creaking sounds when they leaned on the railings. However, they were confident that everything should be fine with them, since the inspection had only been a couple of months ago. Meanwhile, the main character frantically tried to find the right building. He looked through all the establishments that were on this street, but so far he had not seen a single one that had a terrace. However, he understood that he couldn't leave here until he found the right bar. So Sam started asking everyone he passed if they knew where such a bar was, but no one could give him an answer. At this point, the protagonist began to truly panic, as time was running out. While he was running around the area, he was very out of breath, but still could not find the scene of the crime. Looking at his phone, he realized with horror that he only had 5 minutes left. At the same time, he understood that it was impossible to comb the entire area around the station in just 5 minutes. He was afraid that he might not make it in time. Perhaps he believed in himself too much, and this time he would not be able to change anything. The protagonist began to think that it would have been easier to just give up and forget about this whole situation. However, he remembered the words of Dr. Peter that one of the most important qualities of a surgeon was the ability not to panic. No 2 people had the same anatomy, and unforeseen circumstances could arise at any point during the operation. No matter how critical the patient's condition was, it was necessary to react calmly. Peter stated that this was the surgeon's main asset. The protagonist listened to him with admiration, heeding every word of the man he respected. So now he realized that he needed to calm down and find the right building as quickly as possible. And then an idea suddenly came to his mind. Sam realized that he could have used the map. He didn't understand why he hadn't thought of it before. He tried to find an establishment on the map in a narrow alleyway not far from the station and found only 3 suitable places. However, even now Sam couldn't know for sure which of the places he needed, so he decided to just run to each of them. Meanwhile, he had very little time left, but he still had not found the necessary premises. The main character was completely exhausted and could barely breathe from such an intense run. He still couldn't find the right bar and was starting to panic. He only had 1 minute left, and Sam began to fear that it was all useless. And then suddenly he heard someone behind him start swearing. When the main character turned around, he saw that a fight was starting between 2 men behind him. However, this was not what interested him. He suddenly noticed that they were looking at some kind of mascot. When they finally separated, Sam looked up and saw a sign in the shape of a bottle of alcohol. This bottle had eyes, a mouth, a Christmas hat, and various inscriptions on it. And then the main character remembered that he had seen exactly the same bottle on the news in his vision. Sam realized that this place had to be somewhere nearby, so he began to frantically look around. And then he suddenly noticed that right next to him was that very room with a terrace on which a bunch of people were standing. Sam immediately started screaming at the top of his lungs, trying to get the attention of the people relaxing there. However, before he could do anything, he heard the balcony begin to crack. The boards began to break right under people's feet, and soon there was complete chaos. The people, who did not understand anything, immediately began to fall down as the balcony completely collapsed under their feet. But what was even more terrible was that the rest of the building collapsed and a huge beam fell right on them. Iron beams began to fall straight down on the people who were still there. The main character screamed in horror, realizing that this was a very tragic situation. But what surprised him even more was that it actually happened. His premonition had not deceived him again. So he took his phone with a trembling hand and decided to call his friends. Meanwhile, George and Vincent were already relaxing with the girls and did not understand why the hero was so excited. However, Sam said that he didn't have time to explain and that they needed to get back to the station right now. The men didn't understand what had happened, but the hero said they could have considered it an ambulance call. The protagonist stated that it was very urgent and asked the guys to come as quickly as possible. Meanwhile, people around started filming everything on their phones. They were shocked that the terrace had simply fallen off. Meanwhile, Sam tried to get through the surprised crowd and get to the scene of the incident. However, not everyone was happy with his pushing and did not want to let him through. Then the hero had to say that he was a doctor and demand to be let through immediately. The rest of the people immediately froze in surprise, realizing that they really should have let this man pass. So, as if by agreement, they all parted and opened the way for him to get to the scene of the incident. Sam thanked the people for their understanding and immediately headed to the place where the terrace had collapsed. As soon as he reached there, he immediately stopped, as he was very shocked by what he saw. There was a pile of wounded people lying on the asphalt, all of them unable to move due to serious injuries. One of the girls was holding her head, and the other man was squeezing his hand tightly, trying to stop the bleeding. But the hero's attention was drawn to a young man whose legs were trapped between metal beams. Sam was completely confused and did not understand what he should do in this situation, but he decided to calm down. He addressed the people and asked them to call an ambulance. The protagonist understood that in such situations it was faster to turn to a specific person than to the crowd. He said there were 9 casualties in total, some critically injured. Now that the ambulance had been called, he decided to help the seriously injured patients and started with one of the girls. He then moved on to another young man and noted that his breathing was fine. He checked the blood circulation and heartbeat. He needed to check all the indicators to determine a critical condition. He turned to those who were near the wounded and asked for help, explaining that if anyone stopped breathing, they needed to tell him. Sam understood that in situations like these, everyone wanted to help, but no one knew exactly what to do. At that moment, the image from his vision, which spoke of severe bleeding and cardiac tamponade, appeared before his eyes again. Sam knew that the others wouldn't be any worse off if he didn't help them now, so he decided to find these two. At this point, the man, whose legs were pinned by the beams, was finally able to free himself, but he was in great pain. The main character immediately ran up to him and asked how he felt. He complained of pain in his leg. The men who were helping him were doing their best to lift the heavy beam. However, they were unable to do this because it was too heavy and they needed someone's help. Meanwhile, the wounded man continued to scream in pain because his leg was being crushed by such a heavy beam. Sam knew there was no time to waste, so he suggested trying to lift it again. But at that moment, he suddenly heard a familiar voice asking everyone to disperse for a minute. When the hero looked back, he saw that someone had grabbed both ends of the beam with both hands. The others watched in horror as one man lifted something so heavy that the 3 of them couldn't lift. As it turned out, it was none other than George, who arrived just in time to help his friend. After this, he threw the beam aside, thereby freeing the wounded man's leg. Now Sam was finally able to begin his examination, and the first thing he saw was a huge pool of blood. When he looked more closely, he saw a very deep wound on the man's leg. The other passers-by were horrified, as they had never seen so much blood. George immediately realized that if the artery had not been damaged, so much blood would not have spilled. Sam thought it could be the popliteal artery, or the tibial artery, or a bone bleed. Now he had to figure out exactly how he needed to stop this bleeding at this moment. He said that in the movies, after a soldier was wounded, they would bandage the wound to his body to stop the bleeding. Then the hero asked him if he wanted to tell her that she needed to be tied with a tourniquet. In response, his comrade nodded, and the hero realized that this really was a good idea. Immediately after this, George took off his jacket, tore it into shreds, and prepared to make a tourniquet. When everything was ready, they bandaged the wounded man's leg above the wound, trying to stop the bleeding. Soon after, the boys noticed that the blood had indeed stopped flowing from his leg. Sam told George that the guy had fallen from the 3rd floor, so he most likely had internal bleeding as well. So he took off his jacket too, and said that they needed to do a pelvic bandage, and then asked them to wrap the jacket around his pelvis. The hero thought to himself that he had found a patient with bleeding, but had not yet found the one with cardiac tamponade. The thing was that severe bleeding was easy to find, but tamponade was not easy to find. And around the heart there was a membrane called the pericardium, and if blood poured into it, the heart would be compressed. It couldn't function properly, which could lead to death, but Sam didn't understand how he could find such a patient. If cardiac tamponade worsened, the person would lose consciousness, but this would take time. Now the protagonist frantically tried to remember other symptoms of this condition that he had learned, and then he suddenly remembered the 3 main signs of cardiac tamponade. These included low blood pressure, dilated neck veins, and a muffled heartbeat. Since Sam didn't have a stethoscope, he would have had difficulty with the 3rd point, but he could easily check the 1st and 2nd. One of the victims had several broken ribs and a compressed lung, but his pulse was strong and his neck veins were not distended. So he said he would be fine, and he just needed to wait for the ambulance. The protagonist understood that he needed to find a person with low blood pressure, which could be determined by the pulse. However, at least 2 of the victims did not fit the description. And then suddenly, the main character felt that someone had grabbed his wrist tightly. When he turned around, he saw a schoolgirl who was asking him for help with tears in her eyes. She pointed to her friend, who was standing near the wall, and asked him to examine it. The guy himself replied that everything was fine with him, but his girlfriend insisted that he be examined since the railing had fallen right on him. The hero immediately asked where exactly he was hit, and the girl said that the railing fell right on his chest. The guy touched his chest and said that it hurt a little, and then Sam asked him to lift his jacket. When he lifted his clothes, everyone was horrified because there was a huge purple hematoma on his chest. The hero immediately realized that things were bad and began to feel his pulse. He immediately noticed that his neck veins were very swollen. Sam knew he couldn't check the heart sound, but there was no mistaking it. Now he knew for sure that he had found the patient with cardiac tamponade. However, the question now remained of what to do next, and the hero began to remember how to treat cardiac tamponade. He needed to perform pericardial drainage, which involved inserting a needle into the patient's chest and draining fluid. But Sam understood that this procedure should have been performed by at least a senior resident, especially since it required an ultrasound. The protagonist had never done this before, but now he had no choice. But he quickly dismissed those thoughts and decided that it was best to get him to the hospital as quickly as possible. Moreover, at that very moment an ambulance arrived, and the hero decided to rely on them. As soon as the paramedics ran outside, they immediately recognized the main character as a doctor. One of the men said the dispatcher gave him a general overview of the situation and asked if there was a patient bleeding. The hero answered in the affirmative, and then the man decided that he was the first one to be taken away in an ambulance. However, the main character pointed to the guy with the tamponade and said that he should have been the first to receive help. He explained that he needed to be taken to the hospital quickly for pericardial drainage. But before the paramedics could do anything, the guy simply fell on the asphalt and began to choke. His girlfriend tried to revive him, and Sam noted that his heart was beating at 140 beats per minute. He understood that if he didn't do anything now, then what he had foreseen would happen. This boy would simply die. His girlfriend continued to cry inconsolably, and the hero himself understood that the situation was critical. That's why he immediately screamed and asked for help in taking off the boy's vest and shirt. Then he turned to the paramedic and asked him to give him a syringe. The protagonist stated that the boy would not last until the hospital, and he needed help as quickly as possible. When everything was ready, the new patient was placed on a gurney and access was open to his wound. Sam tried to feel for the pericardium, but he knew he didn't have time. He had to get it done on the first try. However, before he could do anything, someone's hand suddenly stopped him. It was George. He shouted that Sam had gone crazy and asked him what he was doing. The hero said he was going to do a pericardial drainage, and George asked him why he decided to do it. The hero explained that after the blow to the chest, the boy had low blood pressure, dilated neck veins, and a cold sweat. George asked if he was going to do the drainage here without instruments, but Sam said that otherwise he would die. George continued to insist, saying that if anything went wrong, he would be responsible for it, since they were just interns. He said Sam needed to stop messing around and instead get the guy into the ambulance. At this point, the protagonist really began to doubt whether he had done the right thing. He remembered Axel's words about never doing anything you can't answer for later. Sam understood that the resident was indeed right. Now he was trying to go beyond the knowledge of an ordinary intern. If something goes wrong, he'll have to forget about the medical malpractice lawsuit. His job as a doctor will be over before it even begins. However, he was suddenly brought out of his thoughts by the voice of a young girl who was standing nearby. She cried and begged the protagonist to save her friend. At this point, Sam felt even more at ease because he had absolutely no idea what to do in this situation. A picture from the past appeared before his eyes when he himself lost someone dear to him. He watched his mother die, and it was a feeling he could never forget. And then he finally decided to help this guy, which did not escape George's attention. The protagonist prepared to perform drainage, and his colleague immediately ran up to him to stop him. But Sam decided not to retreat any further. He began to look for a place to insert the needle, and felt something below the sternum on the left. Finally making up his mind, he inserted the needle into the patient, deciding to trust his hands. Sam realized that his hands felt different from others. One could say that he was born with hands like that. Therefore, he was confident that he would be able to feel the pericardium and ultimately save the patient. If you think about it, Sam was a pretty weird kid from childhood. He helped his father in his fish restaurant and weighed the fish he caught for him. However, the point was that he determined weight to the nearest gram using only his hands. He used this at school too. Quite often he showed off in front of his friends, constantly guessing whether the coin came up heads or tails. His friends were constantly trying to guess what had come up this time. However, no matter how hard they tried to guess, the protagonist always outplayed them, and they began to suspect that he was cheating. The thing was, though, he always felt his hands differently than others. He was born with hands like that. That's why now he also decided to use them, especially since it was necessary. Since he still lacked knowledge, he could only trust the sensations of his hands. He didn't need to touch the heart, but simply pierce the pericardium surrounding it and move very slowly. As the needle passed through the skin layer, as well as the muscle and fat layers, the sensation of the passage changed slightly. Sam knew he should feel it when the needle reached the pericardium surrounding the heart. Meanwhile, the paramedic reported that the young man's blood pressure was 75/50. Sam noted that even now the pressure was dropping with every second because the heart could not work normally. So he decided to calm down as much as possible and continued inserting the needle inside. The main character understood perfectly well that if he made a mistake and pierced the heart, he would simply kill this schoolboy. And then he suddenly felt as if a small electric shock had passed through his fingers. Sam immediately realized that it was the sensation of a needle penetrating a membrane. This meant that, in the end, the main character succeeded and punctured the pericardium. As soon as the needle reached the desired position, Sam immediately began to pump blood out of the bag. As soon as the syringe contained 20 grams of blood, he immediately opened it and poured out the blood. After this, he reinserted the syringe and drew out the blood again. As a result, the entire ground beneath his feet was covered with drops of blood that he had pumped out of the boy's chest. Sam understood that this was his last time, and there would be no more blood left there. At this point, the paramedic reported that the blood pressure was 100/70, and the pulse was 100. At that moment, the young guy even opened his eyes and breathed a sigh of relief. He clearly felt better. Sam was very pleased with himself, and with what he had accomplished. The pericardial drainage had worked perfectly. At that moment, his girlfriend approached the guy and asked if he had really come to his senses. After that, she told his name to the main character, and then he asked her to contact this guy's parents. The situation needed to be explained to them carefully, so that they wouldn't worry. Sam assured the girl that her friend would be okay, but she herself seemed to not fully believe that it was all over. After this, Sam asked George to check on the condition of the other victims. He then turned to the paramedic and asked him to go to the hospital immediately, saying that he would go with them. The man smiled widely and said that Sam was absolutely amazing and asked him which hospital he was from. However, he was shocked by the answer when he found out that Sam was just an intern from Yongguk Hospital. However, they didn't have much time to talk, so they all went to the hospital in an ambulance. Meanwhile, night had already fallen on the city. Axel and the nurses were horrified when they realized that an ambulance had arrived. At the door, they saw the main character, who, together with the paramedic, was driving a patient to them. Sam explained that the patient was suspected of having cardiac tamponade, so he performed a pericardial drainage and removed 60 grams of blood. Axel was horrified and asked the hero if he really did it, while the sister reported the blood pressure readings. Realizing that the patient's blood pressure continued to drop, Axel immediately took him to the ward and said that he would talk to Sam later. While the doctors were preparing to provide the necessary assistance to the patient, the main character was left standing alone in the corridor. Immediately after that, he went to the toilet to tidy himself up. Since his whole face and clothes were covered in blood, he had to wash himself first. Sam was horrified. All his clothes were stained with blood, but now he was more worried about something else. He wondered what he would do if he accidentally hit the heart while trying to drain it. However, deciding not to delve into these thoughts, the protagonist merely exhaled. After that, he headed towards the exit of the toilet, having tidied himself up a bit. There he ran into Charlie, who had just come there to wash his hands. Sam immediately ran up to him and asked what condition the patient was in now. However, Charlie looked at him reproachfully and asked if he had really done it. Without giving him a chance to answer, he grabbed Sam and asked if he had really performed pericardial drainage right on the street. The hero did not understand why the doctor reacted this way and said that he really did it. Charlie asked if he really thought the patient was a toy, and so drained him on the street without any instruments. The hero immediately apologized for his actions, after which he asked again how the patient was doing. Charlie just laughed and said that now he needed to think not about the patient, but about himself. He looked like he got drunk and pulled this stunt, punched a hole in the guy's chest right on the street and didn't think anything would go wrong. At that moment, Sam was really scared. He thought that he had accidentally touched his heart and something had happened to the patient. However, Charlie was quick to reassure him that the guy was fine. Charlie said his heart was intact and they drained the remaining blood from the pericardium. Hearing this, the protagonist thanked him, but the doctor asked him not to burden him with unnecessary problems. After this, Sam asked him again if everything was okay with the patient. At this point, Charlie lost his temper and told Sam not to think of himself as anything special. He stated that the fact that he does what no one else can makes him a tumor in this hospital. Charlie said that it would be very difficult for him to work in the hospital, and he knew exactly what he was talking about. After this, the doctor left the main character standing alone in the corridor. The main character was horrified. He understood that this time he was in deep trouble. He understood that the management worked like a hammer that hammers in a protruding nail so that it doesn't get in the way. At that moment, he was distracted from his thoughts by George's voice, who ran up behind him. After this, the boys put on their medical gowns and went to have a snack near the window. George was glad Sam was okay after doing the drainage in the middle of the street, because he certainly wouldn't have been able to do that. However, George said that Sam was still the sickest bastard he had ever met. The protagonist nodded quietly and said that he didn't even know what he was thinking at that moment. At that moment, someone came up to them from behind and hit the young people on the backs with all his might. It turned out it was Julie. She heard about the guys getting caught up in a medical drama right in the middle of Gangnam Street. She said that everyone already knew about it. The paramedics discussed it and said that they saved many of the wounded. However, Julie was curious why they went to Gangnam Street on a day off instead of sleeping. George said he went out for a walk with Vincent and the others, and that's when it happened. The man was very upset that he was now in the hospital, although he could have continued to have fun with the others. And then suddenly the main character felt some strange sensation. He saw that his colleague Julie was clearly unhappy that they wanted to go somewhere to relax. Soon after this morning came, and the night passed rather calmly. The protagonist was so worried about the patient that he could hardly fall asleep. However, when he sat down at the computer, he saw something very strange there. He noted that the name of the boy he saved yesterday had disappeared from the patient list. This could be explained by several reasons. Either he was discharged or transferred to another department. However, there was another reason why his name could have been removed, and that was because the patient had died. The protagonist was horrified when he realized that this could actually be a very real option. So he immediately started scrolling through the lists in the hope of finding his name, and soon he found it. Then Sam leaned back in his chair and breathed a sigh of relief, realizing that this meant the guy had been transferred to intensive care. After that, he read what happened to the others and noted that, apart from the heart, they had no significant problems. Meanwhile, the other doctors were discussing Sam, noting that it was he who stuck the needle into the victim's chest in the middle of the street. At this moment, Vincent approached the main character and called him by name. He also heard about what happened yesterday, but Sam said it would be quite a long story. Then Vincent showed him the phone and said that the internet was just exploding with news of what he had done. It said a drunk medical intern with a 3-month license was putting an injured patient at risk. When Sam saw the headline of this news, he immediately jumped up from his seat and started asking what the hell it was. He understood perfectly well that at that moment he was not at all drunk, but the news wrote as if he had stabbed someone. The more he read into what other people wrote about him, the more terrible he felt. Vincent understood that Sam wasn't actually crazy, but he still didn't understand why he went there if he was just hanging out with friends. He also said that Sally contacted him and asked him to pass something on to Sam. She told Sam to be careful when flying to Korea because she might throw him out of the plane. When the main character heard this, he completely lost heart, realizing how much he had offended the girl. At that moment, the professor entered the hall and all the interns immediately began to bow to him. As it turned out, it was Professor Sean, the head of the emergency department. He immediately turned his attention to Sam and asked if this was really the same boy. He stated that, in his opinion, the department did not need an intern who played doctor on the street. When the protagonist heard these words, he broke out in cold sweat from Sean's terrifying gaze. However, the man only chuckled and walked further down the corridor. Vincent immediately noticed that Sam was in deep trouble, since Professor Sean was very concerned about his reputation. Meanwhile, the other interns began to discuss the main character and make fun of his situation. At that moment, Sam realized that this was exactly what Charlie had warned him about last night. The whole situation made him feel very bad, but Sam couldn't do anything. He wondered if he had done the right thing yesterday, if he had crossed the line, intoxicated by the ability to see the future. Now, he had absolutely no idea what would happen to him after such a thoughtless act. At that moment, Chelsea came up to him and stared at Sam in surprise. The protagonist was very embarrassed to see her, but the girl said that she just needed a keyboard. Hearing this, Sam finally came to his senses and gave up his seat to the girl. While she was typing something on the computer, he just stood dejectedly nearby. And then suddenly, Chelsea, without looking up from her computer, asked him if he regretted what happened yesterday. The hero replied that he didn't really regret it, but he didn't know if he had done the right thing. The girl then said that there were 18,000 media outlets in Korea, and he shouldn't have allowed even a few of them to throw mud at him. Chelsea was sure he had done what a real doctor should do. He had shown real courage. These words greatly encouraged the main character. Chelsea was the first to support him in this situation. He thought that even if he could go back in time, he would not have acted differently, and therefore decided to take the full brunt of it. At that moment, the girl suddenly came close to him and whispered something in his ear. She decided to try to help her colleague because he helped her when she got into a difficult situation. However, their conversation was interrupted by Axel, who approached them and called Sam by name. He looked at him with a serious look and asked the young man to go away with him for a minute. When they were alone, Axel said he had good news and bad news and asked which one Sam would like to hear first. The protagonist said that he would like to hear good news first, since he had heard enough bad news yesterday. Then Axel said that the patient he had saved the day before had gotten much better overnight, which made Sam very happy. The man added that he would be taken off the ventilator today or tomorrow. Sam was very happy to hear this, since only those who are significantly better are taken off the ventilator. However, Axel immediately moved on to the bad news, stating that a disciplinary committee would arrive tomorrow and they would decide what to do with him. However, in response, the hero only laughed and said that he understood him. The point was that he expected it to happen, and since it was inevitable, it was better for it to happen as soon as possible. Hearing this, the resident only sighed wearily, asking why he had gotten involved in this at all. The man said that if he had just not shown off until the end of his internship, he would have had good grades this month. However, the main character said that he could not do anything in that situation. At that moment, there was a wounded man lying in front of him, and he couldn't just leave him. The hero asked himself what he would do in such a situation, when only he could help the person. He doubted that in such situations there was any choice at all but to provide assistance. These words surprised the man very much, and he didn't even know what to answer. He then jokingly cursed at Sam, saying that the damn boy could leave you speechless. However, he asked him not to think about it, and asked him to answer clearly and confidently before the committee tomorrow. Sam asked what questions he should prepare for, but Axel himself didn't know, since this was the first time he had encountered anything like this. However, he asked Sam to try his best, since depending on the results, the hospital might require his care. These words came as a real shock to the protagonist. He didn't even think about leaving the hospital. The next day, he already went to a committee meeting where they were to decide what to do with him next. 3 doctors sat in front of him, including Professor Sean, head of the emergency department. Besides him, there was Professor Sawyer, head of cardiology, and also Hannah, professor of the education department. Sam then turned his attention to the man sitting next to him, noting that he was from the hospital's legal department. Once all the necessary people were in place, Sean said they could begin. However, Hannah said that the head of the thoracic surgery department had not yet arrived, and this case was related to the heart. At that moment, the doors suddenly swung open, and the man apologized in a cheerful voice for being late. Professor Hank, the head of thoracic surgery, entered the office, looking not at all as serious as the others. Sean asked him if he had come here straight after the surgery, and Hank asked him in surprise how he had found out about it. Hannah explained that he had given himself away with his headdress, and the man immediately rushed to take it off, laughing at their attentiveness. Sam noted to himself that this man was worth paying attention to, since he didn't think there were any doctors like him left in the hospital. Moreover, his name somehow seemed vaguely familiar to him, and he wondered where he might have seen it. At that moment, Hank turned to face him and asked if it was really that guy. The man said it was the boy who made every surgeon's dream come true in the middle of Gangnam Street. He looked at the main character with great interest in his eyes, clearly admiring his actions. The hero was even surprised by this reaction, since he was used to professors treating him negatively because of this. However, Hank was thrilled that he performed pericardial drainage in the middle of a busy Gangnam Street. He stated that he had always wanted to try something similar himself, but unfortunately, he never got the chance. He also noted that this boy managed even without ultrasound, and it was very hard to believe. Hank then asked if anyone in the room had ever had pericardial drainage performed outside of the hospital, but the others remained silent. At that moment, the main character realized that professors can be completely different. This Hank was clearly different from the others. However, suddenly he was overcome with panic, because Sam understood that his future was being decided right here and now. But he understood that he shouldn't panic. If he explained himself honestly, then maybe the other professors would understand him. At that moment, Sean asked him if it was true that yesterday, under the influence of alcohol, he had performed pericardial drainage on the street. The protagonist, without any hesitation, answered that this was indeed the case. With this answer, he left the professors sitting in front of him in a state of genuine shock. The main character immediately cursed because he was nervous and answered too confidently, which made Hank laugh. However, Professor Sean didn't find it funny at all, and instead he began to get irritated. He asked if the hero had really installed drainage in the middle of the street, at the station, without explaining the possible complications. He ignored the basic rule that the procedure must be carried out under sterile conditions. Then he asked the main character if he had really done this relying solely on the sensations of his hands. At that moment, a heavy silence fell over the office. The hero became nervous and did not know what to answer. However, he then pulled himself together and said that this was indeed the case. He had no equipment. Then Professor Sean asked him if he had thought about using portable ultrasound in the ambulance. At that moment, Sam realized that he hadn't known the ambulance had an ultrasound. Sean grinned, knowing immediately that the intern had no idea about it. The protagonist confirmed that he really didn't know about it. Sean then asked him if he admitted that, with the equipment at hand, he decided to perform a dangerous procedure. The protagonist understood that if he had used it, everything would have gone much safer, so he confirmed it. Afterwards, Sawyer said that, as far as they could tell, the procedure had not caused any complications and the patient was recovering without any problems. The lawyer added that, according to the rules, in an emergency situation it is permissible to act without consent, and from a legal perspective there are no problems. But Sean said they couldn't rely on the law alone and asked who would take responsibility for street operations. At this moment, the other professors lowered their heads without answering. Sam knew that he would likely not be able to avoid serious punishment and might have to leave the hospital. However, at this point, Hank entered the conversation and said that he would like to know something. He asked the protagonist with a smile how he knew that the patient had a tamponade. He was sure that Sam hadn't just guessed it. He was curious how he had discovered it. Sam replied that he used Beck's triad to check, and he found hypotension, distended veins in the neck, and loss of consciousness. However, Sean said that pneumothorax had the same symptoms, but a completely different treatment, and yet Sam decided to puncture the pericardium. The hero understood that he was right. During tamponade, blood compresses the heart. During a pneumothorax, air fills the chest, which has different causes but the same symptoms. The protagonist did not understand how he could explain this, and therefore he had no other choice. He confidently told the doctors that he had indeed seen the future. The other professors immediately jumped up from their seats with delight, rejoicing at having met the all-seeing one. They immediately began to apologize to the protagonist for accusing him and called themselves useless professors. However, all this was only in Sam's imagination. In reality, he understood that everything was not so easy. Therefore, in response to this question, he stated that the patient had received a blow to the chest. The falling fence hit him right in the chest near his heart, causing injuries, and Sam initially wanted to take him to the hospital. However, he developed cardiogenic shock so quickly that he had to deal with it immediately. When the professors heard this, surprise and interest immediately appeared on their faces. At this point, even Professor Sean didn't know how to counter this answer. Hank stated that since there were no other injuries that could have caused the pneumothorax, Sam suspected tamponade. He stated that it was the most critical decision the intern could have made, and that he was ultimately able to save the patient. However, Sean said he could have just been lucky, otherwise the patient could have died. He stated that in any case, discipline must be maintained to prevent such incidents. At that moment, their conversation was suddenly interrupted by the office door opening sharply. A man in a white coat came inside with an assistant and said that they had all done a great job. As it turned out, this man was none other than the vice director of the hospital, and this shocked everyone present. The man apologized for interrupting them, but he needed to resolve the issue as quickly as possible. His PR strategist said they needed to make a press release as soon as possible, and for that, they needed photos of the young man. However, the main character was puzzled as to why they needed to photograph his face. Hannah said that if she was going to be featured in a news article, he might need to make an offensive face in the photo. However, the PR manager asked everyone to look at the recently released news, and the professors immediately picked up their phones. The vice director then turned to the protagonist and said that he should also look at it. Sam was puzzled as to what could be there, but he complied and reached into his pocket. When he opened the news, his eyes widened in shock. The top search query right now was about the intern at Gangnam Station. The news reported that medical interns rushed to save the victim and miraculously succeeded. In the comments, people wrote about how amazing they were as young doctors and praised the hospital where they work. The photographer said that until this morning, the comments were negative, but after everyone saw the video, their opinion changed. Therefore, they needed to make a press release about the hero of the occasion as soon as possible, before a wave of negativity arose. The vice principal said that their intern would become public property, and it would be very funny if they decided to punish him and found out about it. When Sean heard this, he immediately tried to laugh it off and did not contradict the vice principal. After this, the man ordered everyone to hurry, as they needed to post everything online as quickly as possible. Then Hank suggested pretending they hadn't called a council meeting to scold Sam. Once everything was decided, the protagonist bowed and apologized to the professors for disturbing them. However, before he could leave the office, the vice director called out to him and said that he had heard about him. The man said Sam was described as a hard-working, responsible, and excellent young doctor. Sam was shocked because the vice principal was out of reach of the intern, so he didn't understand how he could have heard about him. Nevertheless, he bowed to the man and thanked him for such kind words. However, when the hero looked up, something caught his attention. He saw a badge on the vice director's robe, which had the name Ham on it. At that moment, he realized that this was Chelsea's last name, and that the person in front of him was none other than her father. Sam was shocked. He knew Chelsea had strong support, but he never imagined that her father would be the vice director. The man said he heard that Sam had helped his daughter Chelsea during her internship. However, the hero only said that in fact it was Chelsea who helped him. She was a smart and very hard-working friend. The man said he was sure he was just trying to appease him, but thanked him for looking out for Chelsea. After that, he decided to leave his job in the PR department and asked to get Sam in order because he would represent their hospital. At that moment, the hero suddenly remembered Chelsea's words that she would help him, no matter what it cost her. Soon after, the protagonist and his friend went to a photo shoot for the news. While the photographer was taking pictures, he asked the guys not to be so sluggish and to strike striking poses. He asked if they really decided to go out with sour faces the first time they were being photographed for an important article. They needed to show that they were full of enthusiasm and passion, so that it would feel like they were real professionals. The photographer explained that he was talking about the vibe that the young medic should emanate. At this point, George decided to show off his muscles, thinking that this pose would be suitable for a photo. The photographer said it was a great pose and asked Sam to do something similar. He began photographing the young people with great enthusiasm, pleased with the poses they took. The guys tried their best to make the photos impressive. They made every effort to please the photographer. Sometime later, the article with their photographs was finally published. However, to the protagonist's horror, one of the worst photographs he took was used for the article. Now he started receiving a lot of messages from people. Even his family started writing to him. Julie was very happy for her comrades, and for the fact that everyone now considered them real professionals. She herself called them real modern doctors who are ready to risk their lives for the sake of a patient. George noted that their story had been discussed online all day today and was the most popular story in the main news. Julie also noted that, among other things, there were tons of funny comments. However, George didn't understand why only the boys were commenting on him specifically and why their comments reeked of sweat. Soon after, the protagonist headed to room 1705, where his recently rescued patient was lying. As it turned out, the boy felt much better, and he and his mother thanked Sam for saving him. However, the main character said that there was nothing to thank him for. He only provided first aid, and other doctors saved him. However, the mother said she heard that her son survived only thanks to Sam. Then the hero asked her who the attending physician was, and the woman explained that it was a man with glasses and a frightening look. Sam realized she was talking about Charlie, even though he was scolding him as if he wanted to kill him on the spot. The boy thanked the hero for saving him because he thought he was going to die, and after this situation he completely rethought his life. The young man said that he wanted to become a doctor, and although his grades were not very good, he still decided to try. When the hero asked him what his grades were like, he said that they were average at school. Sam said that when he was in high school, he had terrible grades and barely got into medical school. At that moment, a group of school children entered the room. As it turned out, they were the patient's classmates who had come to visit him. They were very happy to see that very young, dedicated doctor who helped their classmate. They immediately asked him to take a photo with them. At that moment, out of nowhere, a photographer appeared and decided that this would be a simply amazing photo. The man said they could use the photo of the doctor to promote the hospital. Since no one objected, he took another photo with Sam, the patient he saved, and his classmates. After that, he told the hero that he was so popular that this was to be expected from their internet and asked if he would have time tomorrow. Sam said that tomorrow was his last day of internship in the department, so he would be busy. However, the photographer promised to talk to his superiors so that they could give him some time since he had an interview tomorrow. Sam wanted to refuse because he felt he was being pressured, but the photographer said he was already a national sensation. He asked him to think of it as a personal help to himself, since they had had very little news in recent years. He said that under Professor Peter, they did not have such a problem, but he retired 3 years ago. At that moment, Sam realized that he was talking about the very man who became his mentor and inspired him to become a doctor. The man said no one knew exactly where Dr. Peter went after he retired. As it turned out, he had been pursuing his hobby for a long time and decided to immerse himself in drawing. The man lived on a remote island where he could peacefully pursue his interests. At that moment, he was just getting ready to draw and sharpening his pencils. At that moment, his assistant Layla came in and politely addressed the doctor. She tried to massage his shoulders and asked why he was sitting there, since it was still cold in the wind. However, the man did not answer her. Instead, he simply continued sharpening his pencils. Then Layla noted that he hadn't drawn anything in 3 days, but Peter promised that he would definitely draw something. He said that everything will be ready when he comes up with what he wants to draw. Layla noted that he had become engrossed in fishing in the past month and asked where his interest in drawing came from. The man explained that he wanted to change his profession, and Layla was surprised that he had only come to this conclusion now. Peter explained that he had difficulty holding anything with his hand, which was used to holding a scalpel. Layla said she thought he just needed something to hold on to because his hands felt empty after the scalpel. She then asked the doctor if he missed the operating table. However, Peter said that he did not experience such feelings at all. And yet the girl reminded him that his name was once again on everyone's lips in Korea. She handed him the phone and asked if he wanted to check the latest news. Although he initially didn't want to watch the Korean news, he still paid attention to the interview with the intern. He noted with surprise that it was an interview from Yongguk University, where our main character Sam was currently enrolled. Listening to Sam's story, Peter noted that pericardial drainage was required in such a situation, and he would have performed it immediately. Only a doctor could have such precision of diagnosis, skill and courage, and not even every doctor could do something like that. And then suddenly he heard the intern say that he decided that they wouldn't have time to take him to the hospital, so he started the procedure at the scene. Peter was very surprised that this young man actually made such a decision. Then Sam was asked one last question about what kind of doctor he would like to become. In response, the hero said with a smile that he decided to become a doctor because he was inspired by Professor Peter. When the man heard this, surprise appeared on his face. Moreover, Sam remembered his words. He remembered that a great surgeon must have 3 qualities: an eagle's eye, a woman's hand, and a lion's heart. So he said that he definitely wanted to become exactly the kind of surgeon that Dr. Peter was talking about. At that moment, the man himself did not know what to answer. He was shocked by such speech. Layla looked at him in surprise, expecting at least some kind of reaction from the doctor. She was very glad that he was smiling, because she had not seen him smile for a long time. However, the man did not answer. Instead, he placed his half-sharpened pencil on the table and went outside. He stopped near the shore and looked thoughtfully towards the sea, still thinking about Sam's words. Meanwhile, the incidents at the hospital did not end. A married couple arrived there with a problem. The woman's wedding ring had pinched her finger. She cried and said that it wouldn't come off, and her husband was very worried that her finger would rot. However, Axel reassured them, saying that they had simply bought a ring that was too small for her. The woman was sure she was a size 10, but her fiancé said she simply shouldn't have ordered food late at night. When the girl heard this, she became very angry, while Axel asked Sam to bring a saw. Soon the protagonist brought the necessary tool, and they began cutting the ring. Axel asked Sam to hold the patient's hand firmly while he cut. When the newlyweds saw the saw in front of them, they both screamed in fear. However, before they could realize anything, the doctors cut the ring and freed the girl's finger. She was very surprised at how quickly everything happened. After this, they headed towards the exit together with the groom and finally thanked the doctors for their help. Sam saw that it was now 6 in the morning, which meant that there should be no more emergency patients coming in. And then suddenly Axel remembered that today was his last day in the emergency room, after which he praised Sam for his work here. He also told him not to worry about his results. After that interview, the professors had calmed down and would not lower his scores. In an interview, Sam said that it was thanks to the guidance of the professors in his department that he was able to save the patient. Now he realized how right the decision was to mention these people in the interview. However, Axel said that they were lucky only this time, but he should not take such risks again. After that, he said that wherever Sam went, he needed to make the most of his internship. The hero remembered his father's words that if you compare life to a boat, there will always be people who will become a tailwind. However, you may also encounter people who will blow in your face, blocking your path. Sam realized he had met a lot of people, a lot of tailwinds, and he wondered if it would continue like this. When evening came, he went with his comrades to celebrate the end of his internship. Sam was surprised that the hospital had rented out the entire place for the evening. There were a lot of people from the hospital there. Julie said it was an informal meeting place for young doctors at the medical college, and they often came here too. However, Vincent added that there was one serious drawback here. It was forbidden to insult anyone from the hospital. At that moment, 2 people approached their table and recognized the local celebrity of their hospital, Sam. The men said they were very glad to see him and invited the protagonist to have a drink with them. Julie said that Sam was the star of the evening, so he should have walked around and said hello to everyone. At this moment, the main character turned his attention to Chelsea, who was simply quietly sipping her drink. He whispered his thanks to her, saying that he had escaped punishment thanks to her father's quick reaction. However, before he could finish his speech, he realized that the girl in front of him was no longer there. When Sam looked back, he saw Chelsea running towards the darts to play. Apparently, there was a small competition going on between the 2 departments. According to the score, the anesthesia department had 99 points, and the emergency department had 61 points. However, at that moment, Chelsea ordered everyone to move aside and make way for her. Taking on a very serious look, the girl took a deep breath and took careful aim. It seemed like she put all her strength and precision into that throw. Once everything was ready, Chelsea threw the dart. To the great surprise of everyone present, she hit the bullseye. Everyone was thrilled with Chelsea because it was only thanks to her that they were able to earn 300 points for their department. At that moment, the main character saw that someone had placed their glass of beer next to him. A young man unknown to him said that he had seen his interview on television and praised him for his excellent work. The main character thanked him, although he did not understand what kind of person he was. At that moment, the stranger suddenly said that he himself would never have done such a thing. First, he would take the patient to the hospital, and if his blood pressure dropped along the way, he would use adrenaline. Then Sam decided to ask him if they had met before, and apparently, the guy was very surprised that the hero did not know him. He felt like everyone knew him, even those who didn't go to university, but to Sam, he just seemed like some weird guy. At that moment, the stranger extended his hand to him and said that his name was River. And although Sam thought it was just a terrible name, he still shook his hand and introduced himself. At this point, River suddenly laughed and said that he had a very strange name, which confused the hero. He then said that he was 24 years old, so he was definitely younger than the third timer, and allowed him to communicate with him informally. Since they were colleagues, he suggested that the protagonist drop all these formal addresses. However, the main character did not understand why this guy was crossing the line. He looked quite scary. So Sam said it wasn't really right to drop formalities when talking to a third-year student. However, in response to this, River only shook his head thoughtfully, after which he asked where Sam was going to go. The hero said that he was going to go to the intensive care unit. River didn't like that answer because he would have liked to work with Sam. It would have been fun to compete. At that moment, Sam realized who he was dealing with and replied that they were all there to study and there was no need for them to compete. Hearing this, the young man only grinned. He said Sam was trying to play innocent, and it was probably the funniest joke of the entire evening. The protagonist didn't understand what was wrong with this idiot, but he definitely understood that he didn't want to get close to him. At that moment, River got up from the table and said that they would run into each other again on shift, and he would look for him. The hero thought that this guy had problems with socialization. He was very self-centered. At that moment, Vincent came up to him and asked him not to pay attention to him. He was a stubborn nerd. Rivera won a gold medal in the biology Olympiad in high school and graduated from Seoul Science High School just 2 years later. He got the best results in his group when he entered Yongguk University and became the best there too. In college, he was called a study monster. He was the best in his class all 4 years, and now he will definitely become the best intern of the year. River couldn't let anyone get ahead of him, and what's more, he had very few friends. At this point, Chelsea entered the conversation and stated with disdain that she really didn't like this guy. He had this vibe that made you dry up just being around him. They just had to talk to him to understand what she was talking about. However, she also said that it was still better than what Jackie was doing now. As it turned out, he got very drunk again because he had the worst result. However, the evening soon came to an end and a new day dawned in the city. As the main character had planned, he came to the intensive care unit and said that he would work here from today on. As expected, the hospital had several intensive care units, and they were divided into several different sections. The 4 interns were divided into 10 intensive care units, and Sam was assigned to the surgical unit at the cancer center. However, now he was interested in something else. He asked the nurses where the attending physician was. The girls were very surprised that Dr. Parker had not arrived yet, because if he was late again, the professor would kick him out. Right at that moment, the doors of the department swung open, and a very imposing-looking man walked in. He said he got stuck in the bathroom and almost died of constipation, and it turned out it was surgical resident Parker. He explained with a broad smile that doctors also need to have good bowel movements to be healthy. And then suddenly he noticed the new intern. Sam immediately introduced himself and told him his name. The man shook his hand and said that he had heard a lot about him and was very glad to meet him. However, the first thing the protagonist thought was that Parker had a very unpleasant handshake. At this point, the nurse asked him if he had washed his hands after using the toilet, but Parker said he couldn't remember. At this moment, the hero was confused. He completely did not understand how this man could even be a doctor. Immediately after meeting this man, he went to the toilet to wash his hands. He felt disgusted and repulsed by the realization that he had shaken his unwashed hand. Parker himself followed him in, clearly unhappy that the nurse had sent him to wash his hands like a child. However, he decided to obey and do as she asked. But when the main character saw exactly how this man washes his hands, he was indescribably shocked. As it turned out, he was washing only the tips of his index fingers, ignoring the rest of his palm. The main character did not understand at all what the point was in washing only the tips of his fingers. In his understanding, this guy was absolutely abnormal. He clearly did not look like a doctor. Soon after, Sam had an appointment with Oscar, a professor of surgery in the department. All the doctors and nurses bowed as soon as he entered the department, and Oscar greeted them all as well. Afterwards, he turned to Parker and asked if he had checked any patients today. The man tried to laugh it off, saying that he had done it, but only superficially. Apparently, Oscar was very unhappy with this answer. However, he did not scold Parker, and instead sighed with displeasure, and said that he needed to improve, because it was because of him that he was going bald. After this, he turned his attention to the main character, realizing that the same new intern was standing in front of him. Sam immediately bowed to Oscar, introducing himself and saying that he really wanted to work with him. The man said he recognized him as the intern who had been featured on the news and noted that he had shown courage and resourcefulness. After that, he gave him a friendly pat on the shoulder and told him to work hard. Once the introductions were over, Oscar called the boys to follow him to begin his rounds of patients. Sam had heard that if the emergency room was the gateway to the hospital, then the intensive care unit was the place where life and death fought. The most critically ill patients, whose condition had suddenly worsened and who needed mechanical ventilation, were gathered here. There were patients here who had just had surgeries, patients who had had organ transplants, and all of them were in critical condition. Oscar then decided to start with the patients in ward number 1, noting that 2 days had passed since the rectal resection. As they discussed the blood loss and his hemoglobin levels, Sam began to think he didn't understand everything they were talking about. However, the pace of work in this department was very fast, so he clearly realized that he needed to get into it as quickly as possible. Quite quickly, the main character became completely exhausted. They spent a lot of time with each patient. They spent about 15 minutes on each patient, and so a whole hour had already passed. At that moment, he suddenly noticed Parker standing next to him. He felt like something was wrong with his facial expression. He stood completely still. Sam was delighted because his legs were already hurting a lot, but the doctor did not even change his position and listened to the professor the whole time. But suddenly at that moment the hero saw that Parker was drooling and that he had started snoring. The hero realized in horror that the doctor had simply fallen asleep standing while making his rounds to see patients. And then suddenly Oscar turned directly to Parker, asking him to come closer, but he did not respond because he was sleeping. Sam immediately realized that he needed to help him, and so he poked him in the back with his pen as hard as he could. The doctor screamed loudly from the sudden pain, but still woke up. Oscar then said that it was not right to ventilate the patient like that and asked Parker why he did it. At this point the doctor was completely at a loss, and then the professor repeated his question. The answer surprised him greatly. Parker said that it would hardly be comfortable for the patient to breathe like that. The man yelled at the doctor and said that the patient's lung pressure was increasing, and comfort was not considered a valid reason. Sam noted that pressure in the lungs can increase due to improper installation of the ventilator, and this can damage the lungs. However, realizing that shouting wouldn't achieve anything here, Oscar just sighed and asked Parker not to forget about it. Immediately after this, he turned to the new intern, noting that this might be a difficult question for him. However, he still asked what they needed to do now to reduce the pressure in the lungs. At that moment, Sam wondered what they would do with Parker if the intern could answer the question that the doctor could not. He didn't understand what to do. He couldn't answer correctly, but he couldn't answer incorrectly either. So he said something vague about the breathing rate and added that, in his opinion, one of the pressures needed to be adjusted. Immediately after this, the protagonist apologized, saying that he had learned it but did not remember it perfectly. In response, Oscar just chuckled and said that Sam had listed everything that could be adjusted. He stated that this was a perfectly adequate answer for an intern, and these words made the protagonist breathe a sigh of relief. Immediately after this, the professor began to explain what exactly needed to be done in such a situation. When it was finally over, Sam walked tiredly down the hallway, noting that it had taken 2 hours to round on patients. At that moment, Parker came up behind him and put his hand on his shoulder. He said that it was their first day together and they hadn't properly introduced themselves yet, so he offered him a coffee. Without thinking twice, Sam agreed, and together, they went to a nearby coffee shop. Sam was worried that they were there during business hours, but Parker said that if he was called, he would just run back. After that, he asked the new guy what he wanted to drink, and Sam said an Americano on the rocks. Parker said there would be grapefruit iced tea, then started playing on his phone. Sam was surprised because he thought Parker would be the one to bring them drinks, but it looked like he had no intention of doing so. Sam then decided to go get the drinks himself, and Parker replied that he was very grateful to him for that. In response, the hero only smiled tensely, silently noting the strangeness of this guy. He soon brought the drinks they had ordered, and Parker contentedly sipped his tea through a straw. He noted that the drink was simply wonderful, and it was even tastier because a newcomer brought it to him. Sam didn't understand why Parker was now calling him a newbie, since they weren't even from the same university. Then the doctor said that he had heard about Sam, and that he did not come from Yongguk University. The hero said that he actually graduated from Yilong University, which greatly surprised the man. He asked the hero if he was talking about the dump that went bankrupt and closed last year. He then jokingly noted that Sam was probably embarrassed since his school had closed and he couldn't even tell people that he graduated. Sam didn't understand what was wrong with this guy. He was laughing right in his face, and even Jackie didn't make fun of him like that. At that moment, the doctor suddenly leaned very close to him, which put the hero in an awkward position. Parker admitted that he, in fact, also attended Yilong University. Sam was very surprised when he heard this, but the doctor asked him to be quiet. He said that after graduation, he completed an internship at another hospital and only then ended up here. He then asked if the new building with the hall had finally been completed, but the hero said that it had been abandoned before the project was completed. Then Sam said that he would never have thought that he would meet a doctor from their university. However, Parker said that he did not like being called doctor and asked to be called senior from now on. He explained that other people had younger and older siblings with whom they interacted and ate, and he was bored without his younger sibling. He also said that he was ready to take responsibility for Sam and help him get good grades as his junior. Parker was so inspired by his promises that he even dropped his wonderful drink. After that, the guys finally returned back to the hospital. At that moment, the protagonist heard his phone start ringing, and he was told that a patient in room 8 was developing a fever. They needed to do blood cultures before changing antibiotics, and Sam said he'd be right there. However, as soon as he hung up, his phone suddenly rang again. Another nurse said that they needed to remove the catheter immediately because the patient was being transferred to a regular room. Sam was surprised that he had 2 urgent calls at once and realized that he shouldn't have gone to the cafe with Parker. So he told his elder that he was going back to work because he had a lot of tasks to do. The doctor himself said that his back started hurting very badly after his morning rounds. Sam noted to himself that he was very different from Axel, who from the very first day tried to teach the interns as much as possible. Then the main character realized that it seemed like nothing like this was waiting for him this month. Confident that he would have to figure things out on his own, he went about his business. First of all, he went to the patient to collect a blood culture from him. Immediately after this, Sam went to the second patient to remove his catheter. When he looked at his watch, it was already 10:10 in the morning. The protagonist was very pleased with himself, as he had finished the job faster than he had expected. At that moment, a nurse approached him and said that another patient needed to have his bed sores treated every morning at 10 o'clock. Sam immediately remembered that he had been told that there would be 1 patient transfer, which would require 5 people. Then he told the nurse that he would be ready in a second. Taking the shift log with him, he headed to the ward, trying to find information about dressings as he went. The work records contained hourly records, call schedules, work instructions, warnings, and supply instructions. Sam knew he just had to follow this journal today. However, he was so immersed in his reading that he didn't even notice the nurse walking towards him. However, before the girl had time to fall from the collision with him, the hero managed to catch her by the shoulders. He immediately apologized to her, saying that he had not been looking where he was going, and asked if she was okay. The hero's gaze immediately fell on her badge, and he recognized the nurse's name. Her name was Catherine. The girl just laughed and said that she was fine. And then suddenly she realized that standing in front of her was none other than the determined doctor from Gangnam Station. She was surprised that he was now working in their department and asked what he was looking for, and Sam said he was looking for bandages for bed sores. Then he looked at the notes again, and it said that the bandages were somewhere in front of the 5th bed. Catherine said that's where most of the necessary things are kept. She asked Sam to let her know if they ran out of anything, and they would give him what he needed from the storage room, and he could also ask any questions. The hero thanked her, noting that this nurse was very active. The atmosphere here was completely different from the one in the reception area. Soon after, the hero went to the ward of a patient named Rose. She was 74 years old. Catherine took her hand and told her that their new, handsome doctor, Sam, would be treating her today. In response, the old woman only smiled, seeing the main character in front of her. Sam smiled at her too, although he felt a little awkward. In patients who spent the entire day in one position, some parts of the body were subjected to uneven pressure. When such an area began to die, the skin would peel off and expose the muscles, which would cause the patient terrible pain. This was called a bed sore. Bed sores were not easy to avoid, and once they formed, they quickly deepened if not cared for. Therefore, to avoid this, nurses often had to change the patient's position, which is what they were doing now. When Rose was turned on her side, the protagonist took the instruments and asked them to lift the patient's clothes. However, when he saw her body, surprise appeared on his face. Her bed sores looked terrible. It was much worse than he expected. He didn't understand how long the patient had been lying in one position, since everything was so advanced. One of the nurses held the tube through which Rose received oxygen, and it had to be held so that it did not disconnect. The hero noted that it was not as easy as it seemed. He was already sweating from having to press the protective film to prevent infection. He could only imagine how difficult it was for the nurses to restrain the patient. However, he understood perfectly well that the patient himself suffered the most. Sam then turned to Rose and asked her to be patient a little longer, as they were almost finished. And at that moment he suddenly heard a strange sound, as if air was starting to come out of the tube. As it turned out, the nurse had not been paying attention to the tube, and it had become disconnected from the part that was attached to Rose. The head nurse immediately yelled at her, asking what she was thinking. At that moment, the nurse realized with horror that she had made a very serious mistake. However, Sam decided not to panic and asked everyone to wait a second. He leaned over to the receiver himself and connected it back to the device. At that moment, the old woman's breathing returned to normal, and everyone was finally able to breathe freely. The nurse who was responsible for what happened immediately looked down and apologized to everyone. But Sam said that everything was fine and asked the girl to give him new gloves. At this point, the head nurse was simply seething with rage and said that she would deal with her later. Sam understood how she felt, but nothing could be done if the staff made a mistake and the patient's life was at risk. Resuscitation is the final stage of maintaining a patient's life, and a small mistake here could lead to fatal consequences. Finally, the protagonist told Rose that everything was ready. Catherine praised him, saying that he had done a great job, and Sam replied that everyone had done well. And then he suddenly remembered that Catherine had told him that the patient had stage 2 colon cancer. The girl said that Rosa had an operation 2 months ago, but then several more were performed due to complications. She was put on a ventilator due to pneumonia, the cancer had metastasized to her lymph nodes, and she couldn't even take chemotherapy. Rose spent 70 days in intensive care and was unlikely to leave, although Catherine would have been happy if she had moved to a general ward. The girl then asked the protagonist if this was his second internship. She noted that Sam didn't seem scared when the breathing tube popped out, although interns usually panicked in such cases. Sam noted to himself that it seemed like she was right. Perhaps he had been toughened by what he had been through. The hero smiled, realizing that he was growing as a doctor and as a person. However, right at that moment he felt that same strange feeling again. He again found himself as if in a completely different space, realizing that now he would again see some kind of vision. Suddenly he heard a gurney with a patient on it rolling along the floor next to him. Then he saw 3 crying people pushing a gurney with a patient in it. Parker and Catherine stood nearby. The nurse was very sad that the patient had died. At that moment, the hero realized that he was once again being shown how a person dies. He realized that someone had died in intensive care, and now he wondered who that person could be. So Sam reached out to lift the blanket and see who was lying in front of him. But before he could touch the blanket, he was suddenly jerked out of this state. Frightened by what was happening, the main character screamed sharply, which greatly frightened Catherine, who was standing nearby. She asked him what he was doing, and Sam immediately began apologizing to her. He noted to himself that in his vision someone died at night and was taken out covered with a white sheet. Sam then examined all the patients lying there, noting that he did not find out either the date or time of death of that person. Moreover, there were not 1 or 2, but more than a dozen patients here, and all were in terrible condition. His vision was of night, and the elder Parker was there along with Nurse Catherine. This meant that their shifts overlapped that night, and according to the schedule, it was either May 11th or 22nd. Sam realized he needed to work shifts those days, so he called and said he wanted to change his shift schedule. Some more time passed from that moment. Parker approached Sam and offered to have a cup of coffee, but the hero said that he was very busy today. However, the doctor said that he just needed to relax, because he had already said that he would give him good grades. But Sam still stood his ground and said that they could only go after work. In response, Parker simply called him a bore and jokingly wished him to go bald soon. Meanwhile, Sam headed towards Catherine, and the girl asked him if he was looking for something. The hero said that he was supposed to change Grandma Rose's bandages soon, but it seemed that not all the medicines were in place. Catherine didn't notice that they were already out of skin ointment and Sylvadine ointment, so she decided to take them from the storage room. The hero offered to go with her. He wanted to see where everything was, and the girl was happy to keep him company. On the way, she also said that yesterday she saw the program in which the main character gave an interview. She enthusiastically repeated his words that a surgeon had to have the eye of an eagle, the hand of a woman, and the heart of a lion. Catherine said that he looked really cool on screen and was very photogenic, but Sam only felt embarrassed by such words. Soon after, they came to the storage facility, and Catherine said that sometimes they ran out of inventory. After that, she reached to the top shelf to get the box she needed. However, it seemed that her height did not allow her to reach the boxes, despite her efforts. Without thinking twice, the main character came up and helped her get the box from the shelf. Catherine remarked that the doctor was very tall, or that he simply had long arms, and Sam asked if she needed anything else. Then the girl said that they also needed to take the Sylvadine ointment, which was also on the top shelf. Hearing this, the main character immediately reached for the right box. At that moment, Catherine felt that they were very close to each other. She became very embarrassed and immediately lowered her face, but because of this, she only pressed herself closer to Sam. At this moment, the hero became very embarrassed, and the nurse immediately asked him for forgiveness. After this, they turned in different directions, as they were both very embarrassed. Soon after, the protagonist, along with the nurses, went to the patient to treat her bed sores. This time, it took them less time and went without any unforeseen situations. Once the processing was completed, Catherine praised Sam, saying that he had done it very quickly. And then suddenly the guys saw that the patient was pointing her finger somewhere. Catherine immediately realized that her grandmother wanted to tell them something and was pointing to the board with a marker. So the nurse handed her a tablet, and the woman was able to write what she wanted. As it turned out, Rosa wrote words of gratitude for the doctor and nurses. Catherine said that, apparently, Sam really liked the grandmother, and the main character was very happy to hear this. He gently took the old woman by the hand and said that she would soon get better and he would make sure that she received excellent treatment. The woman was very glad to hear such warm words from the doctor and smiled tiredly. After this, the main character went back to the office where Parker was already sitting. Without taking his eyes off his phone, he asked the hero if he was coping with his job. He said that he was a good guy for working so hard, but he shouldn't have gotten too close to the intensive care patients. Sam asked him why he said that, but the doctor said that if he said something, then that's what had to be done. However, the main character completely did not understand the meaning of his words and his request. A whole week had passed since then, and soon our protagonist began working the night shift. All week, Sam slept very poorly. He couldn't sleep because he was thinking about which patient would die and how exactly. He went through a number of complications that could arise after the operation, including myocardial infarction and thromboembolism. However, now Sam didn't know whether he should just wait for the call or sit in intensive care all night. He didn't understand who he saw in the vision. It could have been a 23-year-old man, but yesterday he was told that he was on the mend. It could have been a woman who had undergone surgery to remove stomach cancer, or a patient who had suffered a stroke. And then the realization came to the main character's head that it could have been Grandma Rose. In fact, she was the most likely candidate. Her CT scan was abnormal, and her colon cancer had metastasized to the peritoneum. If Grandma's condition becomes critical, Sam will have to do something. So the protagonist went to her and asked the patient how she was feeling. Granny pointed forward again, asking the protagonist to give her the tablet. When Sam handed her the tablet, she wrote him a wish for good food. At that moment, tears even appeared in the protagonist's eyes. He took the old woman by the hand and promised that he would eat well, and also asked her to get well soon so that they could eat together. When Rose heard this, a sincere smile appeared on her face. Thus the main character sat next to the old woman almost the entire night. When morning came, visitors began to arrive at the hospital to visit their relatives. However, the main character noticed that there was absolutely no one near Rose's bed. Catherine told him that Rose had been lying there for a long time, and at first people came to see her every day, but recently they began to come less and less often. For Sam, this was too much. No matter what Grandma's condition was, she couldn't be left alone for such a long time. Catherine said that even family members could not come every day, especially when the patient had been in such a condition for a long time. Sam didn't know what was going on in her family, so he couldn't blame them, but if they visited her, Grandma would gain strength of spirit. Soon after, the hero returned to the office, and soon Parker came in there. He was surprised to see Sam, since it wasn't his shift today, but the hero said that he had personal circumstances to stay. The doctor smiled and suggested that he had changed his shift only to spend more time with him. He then said that he would be on duty so Sam could call him if anything happened. At that moment, Catherine approached the hero and asked why Sam wasn't sleeping, and he said that he would just sit here today. He was actually a little worried about Grandma Rose because he had seen her CT scan results that morning, and they were very bad. At that moment, a sudden realization occurred to Catherine. She said that she actually wanted to tell the main character something. However, she didn't have time to finish because suddenly an alarm sounded throughout the hospital. Sam immediately rose from his seat, intending to immediately find out where the incident had taken place. They were told that they needed to run immediately to bed number 5, where Grandma Rose was lying. When they arrived there, Sam asked Catherine to call the doctors immediately because her blood pressure was dropping. He then immediately took off his gown and asked the nurses to immediately turn on the CPR broadcast. At that moment, Parker swaggered into the room, completely unconcerned about what was happening. The protagonist immediately shouted that Rose's blood pressure continued to drop and they needed to administer vasopressors. However, Parker only calmly asked the protagonist to move away. He stated that they did not need to do CPR. In fact, they did not need to do anything at all. In a completely calm voice, he announced that Rose was a patient with the HP label. At that moment, the protagonist looked at the patient and realized that NR stood for Do Not Resuscitate. They had an agreement not to perform CPR unless there was a realistic chance of recovery. Parker said he had already spoken to her family by phone, and that now resuscitation would only make her relive the pain of her broken sternum. So instead of torturing the old woman, he simply disconnected her from the machine. At that moment, a heavy silence fell over the room. No one could believe that Grandma had died. Tears welled up in the nurse's eyes, and the main character simply froze, unable to understand that all of this was actually happening. He didn't understand how he could just stand there and watch her die, but deep down he knew Parker was right. It wasn't just a refusal of treatment, it was a respect for the patient's dignity and allowing him to pass away peacefully. Her heart was no longer beating, only a line on the monitor was flickering faintly. Essentially, Grandma Rose was no longer there. However, the main character was sure that the grandmother's soul was still somewhere nearby. Soon after, Rosa's relatives were informed that she had died. Her children immediately came to the hospital. They were incredibly sad that their mother had died. The nurses also couldn't hold back their tears as they watched this tragic scene. However, there was nothing to be done. Rosa's heart no longer beat, and she was able to leave this world in peace. Parker then pronounced patient Rose dead at 3:20 in the morning. Despite everything that was happening, Sam didn't cry, he didn't have tears, he was just very angry. He knew in advance about the patient's death and still couldn't do anything. Then Catherine said that they would clean the medical equipment, and after that, Rose's children could come back to see her. After that, she politely asked them to wait a little outside the door. When they left, Catherine asked Dr. Sam to remove all the tubes and tidy up the place. Parker asked the protagonist if he could handle it, and offered to do it, instead of him, if he didn't want to. But despite his depression, the protagonist agreed. The patient was already dead, and now all he had to do was do his job. Then Parker asked him to cut everything out, take out the tubes, and if there was a lot of bleeding somewhere, just put in a couple of stitches. He said that Sam didn't need to be too upset. Rose was already dead, so this was the only way he could help her. In the end, the main character did not resist and agreed. After some time, her room was cleaned to a shine. By then, Rose's body had already been taken away, and Catherine had put new bed linen on her bed. She praised Sam, saying that it was his first time working with a dead person's body, and he did a very good job. Sam replied that if he had known that she would leave them so suddenly, he would have at least tried to talk to her again. He thought that she was so lonely and scared in the intensive care unit, and he felt very sad that he did nothing as a doctor. These words made Catherine think. At that moment, the main character suddenly looked down and saw that the same board and marker were still on the floor near the bed. He realized that it was the same board that his grandmother used to write her thoughts. He looked down at the sheets of paper and saw that they were all covered with words of gratitude. The protagonist understood that every year about 300,000 patients were admitted to intensive care in Korea. More than 40,000 of them died in hospital, with a mortality rate of about 14%. The statistics seemed so insignificant, but seeing a person die with your own eyes was something else entirely. At this moment, the protagonist was distracted from his thoughts by Catherine's voice. To somehow smooth over this sad situation, the girl suggested that he go somewhere in the evening. The main character did not refuse, so they decided to go to a nearby cafe to have a drink. The main character admitted that he didn't even know that there was such an interesting place next to the hospital. Catherine replied that the chicken feet there were absolutely amazing. When she first became a nurse, her elders put pressure on her, and then she would come here alone, eat chicken feet, and wash them down with soju. After this, the girl took a sip of an alcoholic drink to relax. Soon the atmosphere between the young people became quite relaxed. Then Sam decided to ask how long Catherine had been working as a nurse, because he didn't even know how old she was. Without any undue embarrassment, the girl replied that she was already 30 years old. The hero was shocked to hear this, but Catherine just laughed, saying that she would take it as a compliment. She said that she had been working in the Yongguk Intensive Care Unit for 3 years already, and since this year, she had also been supervising new nurses. She said it took nurses 3 years to get used to the job, and there was even a saying about it. Then Sam asked her if it had been difficult for her to work in the intensive care unit all this time. The girl admitted that it was indeed difficult. There were almost no elders left here, but she had no choice. She said the hospital's intensive care unit had the highest nurse turnover. However, she didn't think Sam should have been worried about it at all. She had seen an interview where he had said he wanted to have surgery, so Catherine asked him why he had decided to take the hard way. However, even the main character himself did not answer this question. Then Catherine said that, in her opinion, he would become an excellent surgeon, and the hero thanked her for such words. The girl explained that she was not just saying this out of politeness. After he treated the body, she was sure of it. Nurses could tell at a glance whether a doctor had skillful hands or not. Moreover, she had never seen an intern put so much care into cleaning a patient who was already dead. Catherine also admitted that it was difficult for her too, but she usually forced herself to be cheerful, otherwise she would not have been able to endure all this. The physical fatigue was manageable, but watching a patient die next to her was a challenge every time. However, Catherine understood that this was their job, and there was nothing much that could be done about it. Sam noted that the girl was right. It really was their job. He understood that he would see many more dying patients, and he had to come to terms with it, but the hero doubted that he would succeed. At that moment, the owner of the establishment approached them, looked at Catherine, and noted that she was back at it. To his horror, the protagonist noticed that the girl had passed out after 3 shots of soju. The owner said that Catherine was not a good drinker, but she came here every time something upset her. She assumed Sam was her boyfriend, since it was the first time she saw her with a man, but the hero said they were just colleagues. After this, he took off his jacket and covered the girl with it so that she would not freeze while she slept. Then he decided to try those very chicken feet that she had been praising. However, as soon as he took the first bite, he felt his mouth literally burn. At that moment, the main character suddenly saw that it started raining outside. The protagonist spent the outgoing month of May thinking that his first patient in intensive care, Grandma Rosa, had died. Sometime after that, he returned to the hospital for his next night shift. However, even after some time, Sam still couldn't sleep normally. Even after that day, he continued to care for many seriously ill patients. He cared for a patient with pulmonary embolism and a patient with acute viral pneumonia. But before Sam could do anything, they died so quickly that even knowledge of the future could not save them. It was hard for him. He felt like a boxer who was knocked out without having a chance to land a single punch. However, at that moment his phone suddenly rang. It was a nurse from the surgical intensive care unit. She reported that the patient Sam operated on today was leaking fluid and needed to have the dressing reapplied. Soon after the call, the protagonist went to the right room where he found his patient. It was a man named Tyler. He was 85 years old and he had had surgery for lung cancer. Sam immediately approached his bed, greeted the patient, and said that he had come to treat and bandage his wound. However, the man seemed to have no reaction to him at all. His face was completely indifferent. He didn't even look at his doctor. At this moment, the main character became confused and wondered what this man was doing. Finally, after a few minutes of being ignored, Tyler looked at Sam and asked if he really was a medic. He said that he had come at a very good time and asked him to look at his wound. Sam was very surprised that he was called a medic and not an orderly, noting that this was a very strange patient. Without thinking twice, he took the necessary tools and began to treat the wound. At first everything went smoothly. The old man did not interfere with him in any way, and Sam did everything that was needed. But suddenly, the main character noticed something strange. When he looked at Tyler, he saw that he was looking at him with extreme displeasure. Sam had absolutely no idea what was happening to this old man and was now completely at a loss. So he decided to check with him if everything was okay with him. To his surprise, the old man shouted sharply that they needed to move forward since everything was clear there. Sam was very surprised but decided not to show it and simply said that they had finished processing. Tyler kept yelling that they needed to go around the exit trench on the right side. At that moment, Catherine looked in on them and rather casually noted that it had started again. She explained that this patient showed signs of delirium, judging by the way his judgment was impaired. The hero knew that delirium was an acute, confused state of consciousness that was more common in elderly patients after major operations. It could resemble dementia, but unlike it, it arose very abruptly and violently. It was more common than one might think, with about 2 out of 3 intensive care unit patients encountering it. The hero then asked Tyler if he knew what year it was, and he said it was 1970. Catherine immediately suspected that something was wrong, and said that it looked like she would have to be on her guard tonight. She noted that in such patients, symptoms usually worsened after dark, and no one really knew why. Then the girl took the flask and said that she would change his infusion solutions. However, since she was so nervous, the bottle simply slipped out of her hands. He landed right at Tyler's foot. The man immediately lowered his gaze and looked at the bottle with horror. Then he suddenly jumped to his feet and shouted that there was a grenade in their trench. He ordered everyone to take cover immediately, despite Catherine asking him not to move. Then Sam showed him the bottle and said that it was not a grenade, but just a bottle of medicine. But the old man still wouldn't calm down and kept shouting that it was a grenade, so the nurses had to hold him back by force. As soon as the hero returned back to the office, he said that the patient had scared him very much. He told Parker about it, saying that it was the first time he had encountered a patient with such delirium. Parker said this grandfather was special. Never before had a patient mistaken the intensive care unit for a battlefield. At that point, Catherine said that, according to his medical records, he had indeed served in Vietnam. Sam noted that his war trauma must have been colossal if memories from 1970 still tormented him so much. The hero then asked why he wasn't in the thoracic surgery intensive care unit if he had lung cancer surgery. However, Parker said their unit was overcrowded, so he was transferred here. This patient was the most violent, but it was not his problem since he was not even his attending physician. At that moment, Tyler suddenly decided to sing the song White Tigers, beloved by 50 million listeners. He stood up on his bed and began singing war songs at the top of his voice. Sam and Catherine immediately tried to calm him down and sit him back on the bed, but he didn't listen to them. Thus, they spent almost the whole day trying to calm the violent old man. Sam barely slept last night, trying to calm Tyler down and ending up completely exhausted. He realized with horror that now he would have to deal with him again this evening. However, when he came again to change his bandage, he was met by a completely different person. He was normal. Sam had absolutely no idea what was going on and asked Tyler if he had slept well. In response, the man laughed and said that thanks to the excellent care, he slept like a baby here. However, he noted that there was something wrong with his voice today, as if it was a little hoarse. After this, the old man suggested that today must have been May 17th, and Sam was surprised that he even knew the correct date. Moreover, he looked quite normal. Apparently his delirium was temporary. At that moment, an intern named Jack suddenly walked into their room and started jokingly talking about grenades. However, Sam immediately ordered him to be quiet, as Tyler could hear them, and advised him to be careful on duty. He said that the old man was fine during the day, but no one knew what he would be like at night. But Jack said he didn't have to worry, because if anything happened, he would just hold him down on the bed. However, everything turned out completely differently than the naive intern had expected. The next morning, he returned to the office with broken glasses and cotton wool that kept the blood from flowing down from his nose. Sam immediately ran up to him and started asking the intern what had happened. At that moment, Jack just silently pointed somewhere to the side. As it turned out, he was pointing to the room in which this crazy old man was lying. Without thinking twice, the main character immediately rushed there and pulled back the curtains to see what had happened to Tyler. To his great horror, his entire bed was covered in blood and he lay motionless. For a moment, the protagonist stood in shock, after which he asked Jack what had happened. He just sighed tiredly, and at first didn't even want to talk about what had happened. He said Tyler suddenly said he needed to pull out his gun and pulled out his chest tube. Blood was pouring out of his chest and splattering everywhere. It was the worst moment of Jack's internship so far. Tyler said he had to go somewhere and wanted Jack to cover for him. He held the chest tube like it was a gun. All the tubes were pulled out and they could barely calm him down with an injection. The nurse could barely give him an injection. Moreover, the old man hit him when he tried to hold him back. Surprisingly, he turned out to be very strong. So Jack warned Sam to be careful while on duty, because the old man's blows were very accurate. At that moment, the protagonist looked again at the old man, who was now lying in absolute calm. After such a commotion last night, he slept very soundly, and the hospital was like a battlefield for him. Soon after this, morning came. Caregivers and relatives began to visit patients to care for them. At this moment, the protagonist noticed that none of them approached Tyler's bed. Then he asked Catherine if he really didn't have guardians, since he himself hadn't seen anyone. Catherine said that it seemed like they really weren't there, only a veteran from the association came a few days ago. He said Tyler had been a Marine, and Sam guessed the lung cancer was probably service-related. Catherine said the veteran who came to visit him mentioned that Tyler had appeared on television when he was healthy. At this moment, the hero took out his phone and decided to search the internet for information about him. What he saw there really surprised the main character. As it turned out, Tyler really did perform on television. There he said that he served as a platoon commander during the Vietnam War. The first operation he was assigned to after being sent to Vietnam was a search and rescue mission. Everything went dark. He was a rookie, fresh out of Marine Corps school, and he trembled at the thought that people's lives were in his hands. Fortunately, nothing happened during the first month. The platoon members felt well, and operations went smoothly. But about 6 months later, several members of their platoon were killed, including Private Chris. He was shot in the face and came back crippled. He was a friend of Tyler's who carried letters from his mother in his pocket. It was a big shock for Tyler, but he had to accept it. That was war, and the enemy probably suffered because of them too. And while others might have considered the war a badge of honor, for him it left only terrible memories, and he still jumped out of bed at night. At that moment, the protagonist realized that the reason for all this was the memories of those days experienced in Vietnam. At this point, the nurse asked Sam to insert an L-tube into the patient in bed number 7 after the visitors left. The protagonist replied that he understood her, after which he looked at his patient again. Tyler was still lying on his bed, resting peacefully after a wild night. Soon night fell upon the city. The protagonist yawned, noting that it seemed the day had ended without any major problems. However, he heard someone scream and immediately jumped up from his seat. It was Tyler again, stating that he needed to go and find members of their platoon. This didn't come as a surprise to Sam. He had expected his delirium to start up again that night. So he immediately ran up to the old man and tried to calm him down, but he didn't want to listen to him. Instead, he pushed Sam away and said that he had to go because members of his platoon had been captured. At this moment, the main character had absolutely no idea what to do. No calming methods helped. He then turned to the nurses and ordered them to immediately call Tyler's attending physician. Sam tried to convince himself that it was just an old man and that he was younger and stronger than him. However, it seems Tyler had a completely different opinion. He immediately suspected that the protagonist was trying to grab him. So, without thinking twice, he decided to hit him first, slamming his fist into his face. He was able to knock Sam to the floor with literally one blow, after which he headed towards the exit of the ward. Having come to his senses a little, the main character rose to one knee and rubbed the bruised area. At that moment, Catherine grabbed Tyler and asked him to calm down, saying that he was in the hospital. And then the hero looked up and saw that Parker was completely calm. He took no part in all of this. The main character immediately turned to him and asked the elder to help. However, he only calmly asked if they had called thoracic surgery, and the hero answered in the affirmative. Then the doctor asked to prepare a sedative in advance and just wait, since this was not their patient, and the surgeons would deal with it themselves. However, the others were not happy with this at all, and Catherine asked Parker to stop watching and help them instead. Realizing he had no other choice, he walked towards the old man, muttering about how everything irritated him. He spoke quietly to Tyler, confident that he would listen. However, the old man didn't even let him start and immediately kicked him in the groin. The force of the blow immediately made Parker's face turn red, and he let out a painful cry. After this, he immediately collapsed to the floor, realizing that he had greatly underestimated his opponent. Meanwhile, Tyler continued to try to break free, saying that he had to save the members of his platoon. At this point, Sam noticed that the chest tube that was connected to the patient was on the verge of coming off. The hero understood that if it was pulled out again, it would definitely negatively affect the patient's post-operative prognosis. However, Sam didn't understand what to do. He needed to calm the old man down, even if just for a moment. And then a brilliant idea suddenly came to his mind. Meanwhile, Tyler continued to struggle and scream for release. At this moment, the protagonist addressed him as a platoon commander and asked him to pull himself together. These words immediately brought the old man to his senses, and he stopped struggling. When he looked forward, he saw his colleague in front of him, who was desperately asking him to calm down. Tyler was extremely surprised that Chris was standing right in front of him. He didn't even suspect that it was just his hallucination, and that in fact it was Sam who was talking to him now. Everyone else stood frozen in surprise, watching how events unfolded. Then the old man asked Sam if he really was Private Chris. The protagonist said that it really was him, that they dodged enemy fire and ran as fast as they could. Afterwards, he turned theatrically to Parker and said that he believed that they would succeed. Parker decided to play along and said that he had received a glancing wound from enemy fire in a very unfortunate place. When Tyler saw his comrades, he couldn't hold back his tears because they had returned alive. Then Sam hugged him, saying that the first thing they needed to do now was treat the commander's gunshot wound. He said he should feel pain in the right side of his chest because the bullet was still inside and couldn't be touched. They needed to prepare the platoon leader for treatment, so he asked Tyler to lie down on the bed. When they finally managed to lay the old man on the bed, the protagonist was able to breathe a sigh of relief. The nurses were delighted with the performance he put on to calm the violent patient. However, at that moment, Dr. Martin from thoracic surgery approached them. He said he'd heard there was chaos here, but Tyler seemed calmer now than he had been yesterday. After this, he decided to examine the old man, saying that at this stage, 1 IV should be enough. Then Catherine told him that their on-duty interns had been taking turns getting punched in the face by him all night. Martin asked how they managed to calm him down, since he could hear him screaming in the background on the phone. He soon learned that their new intern had pulled off something impressive and was immediately interested in him. Martin recognized Sam pretty quickly and remembered that he had been in the emergency room last month. He wanted to shake his hand because he had a feeling that they would meet again and again, and they needed to get along with each other. At this point, Parker entered their conversation and asked why Tyler was not in the ICU. Martin replied that they said there were no free beds in the intensive care unit, so he hoped for understanding on their part. However, he said that if his condition worsened further, they would consider moving him to a general ward. However, Tyler still needed oxygen therapy, so they needed to monitor him in the intensive care unit for a couple more days. Parker then said that if anything happened, they would contact Martin immediately. 2 days later, it happened again, with Tyler still screaming about hearing an air raid siren. Sam immediately ran to him, realizing that he needed to calm him down again. Tyler was screaming about being cold, even though he was asking for the refrigerator door to be closed. However, to everyone's horror, the other patients also began to shout some completely illogical things. The nurses were shocked by what was happening there and did everything they could to calm the patients. Sam also didn't understand what was happening and even began to think that delirium was contagious. However, in the midst of all this chaos, only Parker seemed to remain calm. He walked over to the phone with a sly smile, called the thoracic department, and asked them to come over and take a look at it. Eventually, patient Tyler was transferred to a general ward. Soon after, Sam went to a cafe with Parker, and the doctor was very pleased with what he had managed to pull off. However, Sam was worried about Tyler and that he would cause trouble in the ward, but Parker didn't care. And yet, the protagonist insisted that the old man still needed oxygen therapy. But the doctor said that it was no longer their concern, and that he was not going to worry about thoracic surgery patients. He also asked Sam to keep an eye on his own patients, as there was already a lot of work. However, in Sam's understanding, real doctors threw all their efforts into saving the life of any patient. But Dr. Parker was like an office worker, or maybe even less so. He just wanted to avoid difficult cases and live in peace. Sam didn't understand why he had chosen surgery in the first place, so he decided to ask him directly. When Parker heard this question, a smile even appeared on his face. He stated that he went into surgery to become a cool surgeon. This answer really surprised the main character, and he didn't even know what to answer. However, Parker did not understand why he was surprised at all, and what he hoped to hear from him. Ever since he was a kid, surgeons were portrayed as tough guys on TV, so he wanted to be one. However, Parker now regretted it and asked Sam never to become a surgeon. He said that being a surgeon means spending your whole life dealing with patients who could die at any moment. At that moment, Sam remembered all those patients who had literally died in his arms and understood what he was talking about. Parker said that the harder you work, the more worn out your soul becomes, and that this specialty was exactly what it was about. As a surgeon, you cut the patient open yourself, you stitch him up yourself, and then he slowly fades away after the operation and dies. Parker admitted that when this happens, he can't sleep for a week afterwards. Over time, you realize that it's better to keep your distance from all this. No matter how hard you try, patients still die. At that moment, Sam realized that this guy had been through a lot and that he had been too quick to judge him. But Parker said that in any case, he would not dissuade Sam if he was determined to go into surgery. However, he warned that in that case, the same future awaits him as his. Sam didn't want to become someone like Parker. That's not why he came to the hospital. However, at that moment he was suddenly pierced again by that same strange feeling that arose before the visions. When the hero looked around, he realized that this time he found himself in the surgical intensive care unit. When he turned back, he saw a familiar face. It was none other than Grandpa Tyler. His eyes were red with rage, and it seemed that in the next second he would start destroying everything around him. That's exactly what happened. He broke all the fastenings that were preventing him from moving. After this, he chewed through the tube that was inserted into his mouth and secured with tape. Sam quickly realized what was going on, but he was sure the nurses needed to see it. Meanwhile, the old man continued to tear at all his fastenings. He soon tore off the bindings that held his hands. Finally, he was able to pull the pipe out of his mouth and tore it into pieces. Sam froze in horror when he saw that the old man had pulled out his own endotracheal tube. At that moment, he suddenly heard the sound of a working device. Literally, a moment later, Sam found himself at a funeral where a man was standing next to the coffin. He looked at the portrait of his dead father, Tyler, and cried. The man said he never thought his father would leave without even saying a word of goodbye. He said that he had been angry with him all his life, and that, to be honest, he still hated him. But if he had seen his father just once, then perhaps he would have had no regrets. At this moment, the protagonist was overcome with real horror from this endless despair. Then he screamed sharply, which greatly frightened Parker, who was sitting next to him. The doctor said he understood that he didn't want to become like him, but that he didn't have to shout like that. Sam wondered if Tyler's condition must have worsened, which is why he was intubated. Then, being in this state, he pulled the tube out of his respiratory tract and died as a result. However, now the main character was determined to change the future with his own hands. Now he would definitely not give up.